Here, I've been to China before, but this is my first time in Urumqi. And also, I believe this is my first time to meet a lot of people from the Central Asian republics. I've never met so many of you before. So, if it's okay with you, I'd like to stand up because whenever I sit down in the hall like this, I get nervous. It feels like I have to defend myself before the court. But when I stand up, I feel more relaxed and relaxed. Okay? Maybe just to motivate a bit what I'm going to say for the next 3 sessions is to imagine, for example, that this is usually how we do it in the Philippines and in other countries, but the typical government agency has to defend its budget before Congress for the next fiscal year. So, for example, you want to solve, you observe a lot of rising infant mortality rate. A lot of young kids are dying because of various diseases. So you develop a proposal or a program or a budget that says that you're going to undertake child health interventions that will reduce infant mortality rate in a year's time. So the Congress approves your budget. You have outlined there what you need to buy in terms of input, how much resources that needs to go into doctors, nurses, buying drugs, moving these drugs to where they are needed, so forth and so on. Okay? So as program managers or implementers of the project, you have to make sure that the inputs get delivered, children get treated. By the end of the year, for example, you have achieved, say, 95% immunization rates. So you provided anti-polio, all these vaccines that are needed by young children. So that's your target for the year. So ensuring that the inputs and the targets are met within the fiscal year, that will be about monitoring and the usual evaluation. Because we still is on achieving the results rather than just simply undertaking the processes buying the inputs. The targets should be met. So that would be the emphasis of the results-based monitoring and evaluation. So at the end of the year, the next fiscal year, you report again to Congress, ask for a budget. And Congress says, what have you done with your previous budget? And you said you spent it, you achieved 95% immunization rates of all target infants. And then the Congress would say, so what happened to the infant mortality rate with what you have done? And then you say, well, the infant mortality rate has declined, say from 300 babies per 1,000 to say 150 babies per 1,000 within a year. So that's very good. And you say it's because of our achieving the target immunization rates, we were able to reduce infant mortality rate by half. Then a congressman or member of parliament would say, how do you know that? It could very well be because mothers have been taking greater care of their children. It's not because of your own intervention. So maybe the reduction in the infant mortality rate is not so much about what you have done, but because of other things, like what mothers did to the children. So answering that question is about impact evaluation. How much of the improvement in the infant mortality rate is really due to your intervention, and not because of other things. Because remember, a lot of things are happening at the same time as well. So you cannot fully attribute your activities or your intervention or your program or whatever the full reduction in the infant mortality rate. So that will be covered in the second half of my lecture, the impact evaluation. Measuring how do you attribute the changes in the outcomes to the intervention that you finance or you undertaken within your ministry. But for now, the morning is just going to be about delivering the necessary inputs, undertaking the necessary activities, processes, so that the targets are met. So that's the results-based monitoring and evaluation. Okay, that's just an introduction. So, why do we need to worry about results? Well, this is from Osborne and Graeber, just motivate. If you could not measure results, you cannot tell success from failure, right? And then if you cannot see success, you cannot reward it. If you want to motivate your health workers, for example, by providing them incentive bonuses if they deliver results. But if you're not measuring results, how can you then pay for the incentives? You might end up paying those who did not work, or paying less those who contributed to the achievement of the results. That's basically what is being said in this slide. Okay? Sorry. So what are we talking about here? Results-based monitoring and evaluation measures how well governments are performing relative to the targets. Okay? Results-based monitoring and evaluation is easy management tool. It's not the end-all and be-all of what we do. Okay? It's something that we use to deliver what we want to achieve in the beginning, with the resources that we have. And it emphasizes the assessment of how outcomes are being achieved over time. So again, it's a way for tracking the progress that we have been making through times. Because usually, the targets that we are aiming for are not easily accomplished in a year's time. Sometimes, like for example, for infrastructure projects. In the first year, perhaps the best that you can do is just to bid out to a contractor the budget. Then the budget gets, the contractor gets the budget, and then he takes the construction. And then the third year, perhaps that's when people start to use the infrastructure. So you won't see the actual uses of the infrastructure project until 2-3 years down the line. But we need to make sure that the construction gets delivered, the infrastructure project gets completed in 2-3 years down the line. Okay? So just to situate what we're talking about, I think David was talking about planning for results, budget for results, implementing for results in this typical framework. So I'm going to cover the last two, monitoring results and evaluating results. That's just how it situates in the whole budget planning process in the public sector. Okay. Remember, monitoring and evaluation are two separate but interrelated strategies to collect and report findings on how well the public sector is performing. Okay? So I talked about the monitoring and evaluation as tools and how the tool can interrelate to support the public management. That will be covered in the succeeding slides. And then the 10 steps to build the results-based monitoring and evaluation system to measure government performance. So what is that 10 step? This is the 10-step procedure. So, well, I'm sure most of you are familiar with these 10 steps, probably 5 steps, 7 steps. But basically, in the beginning, you assess what is needed, and then develop the appropriate intervention to address those needs. And then monitoring all the way until the targets are met. That's just basically what's being said. It could be less than 10 steps, it could be 7 steps, 5 steps. It's just a logical approach to a monitoring and evaluating an intervention. Okay, I'll skip that. It's the same thing basically as in the first slide. It's just about the importance of monitoring and evaluation. Okay, let's go to definition. Results-based monitoring, or what we call monitoring simply in this session. It's a continuous process of collecting and analyzing information. Okay? For what? Well, information to compare how well a project, program, or policy is performing against expected results. So we always tie our activities, our inputs, our processes towards achieving the expected results. We're not just budgeting, we're not just teaching, we're not just buying drugs just for the sake of buying drugs. Right? They have to be related as much as possible, in every case, to the results that are being targeted. So the major activities will be setting goals and objectives, reporting to department secretaries, cabinet clusters, congress, and other stakeholders, managing projects, programs, and policies, reporting to donors, and allocating resources. I don't know in your country, but in my country, a lot of development projects get donor funds. And donors, without USA, World Bank, ADB, AFW, the German, AUSTAID, Australian development agencies, are always insisting that the projects that they're funding will have their own MNP component. That is to ensure that the money is well spent for the projects that they are funding. But of course, it doesn't have to be to the donors. You can use your MNP results to report to other stakeholders, to voters, for example, to cabinet secretaries, to other politicians, where you defend your budget before Congress or Parliament. Okay, so the emphasis here, well, the traditional monitoring focuses on implementation monitoring. It's just about inputs, activities, and then outputs. The difference in the results-based monitoring is that the latter involves the regular collection of information on how effectively government or any organization is performing. Okay, as I said earlier, always relate the inputs, outputs, and activities in relation to how far or near we are in achieving the targets we set out to achieve in the beginning. So the emphasis is on results. But to be able to do that, what do we need? Well, we have to understand what we call the theory of changes or causal logic. The idea being is that suppose you provided the input, suppose you undertaken the process, suppose all the necessary activities are undertaken. How sure are you that they're going to lead to the target results? What assumptions should be, what are the underlying assumptions? What are the givens that must be satisfied before those things can happen? For example, in the immunization story, suppose you buy the drugs, you give it to local health workers. What else needs to be done? Or what's happened before the children get immunized? Well, the parents must know that there is such a drug available in the health center. They must know also that the children need immunization. So it's not enough that drugs are there, the health workers are there. The mothers also have to be informed that such and such intervention are available in the local health center before immunizations can happen. So understanding that causal logic, everything that needs to be in place, assumptions that need to be verified before intervention can be effective. So that is what is required as well in results-based monitoring. Because the results may not come not because of the bad design of the project, but because the mothers are not going to the health centers for whatever reason. Okay, so we have to make sure that the mothers will go to them, will bring their children to the health center as well. So in that case, if the mothers are not going to the health center because they don't know, then the intervention should include information and education campaign as well, not only this, the delivery of drugs. Or if the health centers are not accessible physically to the population area, then maybe you have to bring the drugs closer to the homes. You don't expect them to go to your health centers. Okay, so that's what we mean by causal logic in economics. So the key types of monitoring is that the traditional one is about implementation monitoring, right? From input, activity to output. That's the usual implementation monitoring. So the results-based monitoring will talk a little more about the link between outcome and impact. So is this an example, for example, of what are the things that goes into each box? So, for example, for inputs, here we usually talk about financial resources, human and material resources, and then they get translated into activities. For example, you assign who delivers the drugs. For example, is it the health workers in the district hospital? Is it the health workers in the community hospital? Level health center, so forth and so on. So you have to translate the delivery of the drugs or the vaccines in terms of tasks. Okay? And then what are the actual products and services to those? Well, in that case, it's just immunization, right? Or if the intervention includes an information and education campaign, then that should also involve what? dissemination of information materials to bankers or even to farmers. Okay? Am I making sense so far? Okay, so I'll proceed. I'll take that as a yes. Okay, so this is an example of, I just thought of it, a very simple example. New farming technology. Okay, inputs, what they call, for example, facilities, trainers, materials, and the activities. The new farming technology here is just basically an intervention help to increase the productivity of rural farmers. The main intervention is introducing them to a new farming technique, which involves training them, showing them field demonstrations, classroom lectures, information materials, the usual training provided to farmers, for example. Okay? So the output would then be specified in terms of the number of farmers who completed the training course, or the number of farmers who received information materials provided under the program. And then the outcome that we would like to monitor as well is that of those who received the training for information materials or who participated in our program, is there an improvement in their productivity? Is there an improvement in their output? Is there an improvement in their farm income? Okay, and then the goal or the impact then would be a bigger welfare consequence. Would be, has the program contributed to the reduction, for example, in rural poverty? Having helped the rural farmers to increase their productivity, do they in turn then contributed to the reduction in rural poverty? So these are the different indicators that we might be monitoring when we introduce a project like the new farming technology. Okay, so what is this results-based evaluation? It's an assessment of a planned, ongoing, or completed intervention to determine its relevance, efficiency, effectiveness, impact, and sustainability. That's a mouthful, right? That's a lot of things that we want to do in evaluation. To get ahead of my story, the evaluation that I'm going to be talking later is different from this one. It's, the impact evaluation is just whether the project delivered the expected outcome, okay, or not. If it did, how much of the observed changes in the outcome is due to the project. I know it can be confusing because we've been using evaluation in so many ways, and in the development community now more and more of us are talking about impact evaluation, which is slightly different from what we're talking about. Now, the purpose of a results-based evaluation is to incorporate, to draw out lessons from the interventions and then make use of them in the decision-making process. So what kind of questions does evaluation address? So we have different questions there. It could be about process implementation questions, it could be compliance, accountability questions, how questions, and why questions. Okay, the how questions, what is the sequence or processes that lead to the successful or unsuccessful outcomes? Is there something in the causal logic which was not satisfied, which did not happen? We expected mothers to come to the health centers and bring their kids. It did not happen. We brought in the drugs, but the kids were not going with their mothers to the health centers. Okay? The why questions, what was the changes we are monitoring? Okay, if there is a reduction in infant mortality rate, is it because of our intervention, not because of something else? Okay, why do we need to care about the other factors that contribute to the reduction in infant mortality rate? Well, to the extent that we're spending money on our intervention, and if our intervention proves to be contributing very small amount in the reduction in mortality rate, then we might not as well intervene, right? Because other things will take care of the problem. So that's why we have to piece out the marginal contribution of our intervention in the targets. Because we're spending money, government money, which has alternative uses, which can be used for other things. So we better make sure that the money we spend for health, for example, delivers, contributes to our health targets. Okay, so what are the desiderata? What are the characteristics of good evaluation? Well, I always believe, I'm a teacher, that a question well posed and well understood is a question half answered already. Because you can go on answering a question and maybe still not get the answer correctly because the question cannot be answered, cannot be understood. In other words, the question is ambiguous, for example. So getting the questions right is critical as well. Although politicians, for example, would like to ask you, what is your contribution to overall reduction in rural poverty? You may not be able to answer that quickly, right? But what you can say is that our projects, for example, help improve the lives of rural farmers in Xinjiang province. And to the extent that the farmers in Xinjiang province constitute the poor in the province, then we could say that we help alleviate rural poverty through that intervention. You have to explain your contribution to the reduction in rural poverty. So you have to get the questions right to be able to answer it correctly. Of course, answering the question is critical, right? You don't end to be saying that we help the lives of the rural farmers. You still have to correct it to what the politician or the parliament is asking. Okay, but you don't jump from intervention to rural poverty, but make the connection to your portion. Okay? So why is that important? Well, sometimes politicians make those big jumps. The policymakers make those big jumps. It's our job sometimes to caution them that what we're doing is not the magic bullet. It's not the the solution that will solve all rural poverty problems. What our solution is that we're doing is that we're just contributing to the reduction in rural poverty. We're not going to be able to reduce rural poverty. My favorite example or saying is that poverty is one of the most difficult things to solve because poverty is the sum of all bad things that would happen to you, right? Bad genes, bad family, bad community, bad government, bad luck, so forth and so on. So government will only be able to intervene in terms of example in one of those factors that may contribute to poverty. So it's very hard to say that you'll be able to solve poverty. So and yet politicians like those big words, big ideas and all that. So it's our job to caution them and tell them exactly what we can deliver to help reduce poverty. Yeah, it's impossible. It's impossible. Reducing poverty is impossible, perhaps in our lifetime, but who knows? Okay, so here I have two typical examples of evaluation. Let's look at the right column, resettlement. So, like in Metro Manila, we have a big urban slum sector. So one of the strategies that the government has tried before is to relocate the slum dwellers in urban areas to elsewhere, in the less densely populated areas surrounding Metro Manila. So you can ask the question whether that program has been effective or not at different levels. You can ask it at the project evaluation level, program evaluation level, or at the policy evaluation level. So I have listed there some of the questions that are posed at different levels when we evaluate such resettlement project. Another intervention is privatizing water systems. That's another typical, well, at least in the Philippines, a typical program that we have. Okay? Now, let me say though that monitoring and evaluation do separate. They are actually interdependent. Right? Monitoring is more like a day-to-day accounting of the inputs, activities, personnel, so forth and so on. But at the end of the quarter, at the end of the semester, you still have to make an assessment whether those are contributing towards the achievement of the targets. Because that would be evaluation. Okay? So I have listed down there, for example, in monitoring that clarifies program objectives, evaluation analyzes why intended results were or were not achieved. You're not really concerned with that in the monitoring per se. You just deliver the drugs, you just assign personnel, you don't care yet whether the mothers are going to the health center. So the monitoring activity. Okay, so on a daily, weekly basis, that's what you do. At the end of the month, you say how many children were immunized. You deliver all the drugs, you assign all the doctors, but you're still not meeting the target immunization rates in your area. So you would say the mothers are not counted, the children are not counted. Then, with that information, you may want to change your strategy by, oh, don't wait for them to come, let's just go out and seek them. Let's go door to door, knock on the houses, and then ask if they have children born in the last 12 months but not been immunized or active that you want to achieve the target immunization. Okay, but you usually do that after a period of time using the way you program it in the beginning. But you won't be able to change tactic unless you monitor and evaluate the results periodically. Okay. Once the outcomes are identified, it is time to develop a plan to assess how the organization will begin to achieve those outcomes. Okay, you lay down the resource requirements, well, the strategies or the approaches or the interventions that you need to do to best address those needs or achieve those target outcomes. From then, you work backwards, given those strategies or interventions, or then you plan for the resource requirements that you need. How much money is required? What personnel will be needed? How do I deploy them? How do I release the money? What kind of administrative support would my field workers require to achieve those results? So that's part of the results plan. Okay? But the shortcoming of this additional approach is that completing all the activities does not mean the same as reaching the outcome goal. Again, I'm just re-emphasizing what I've said earlier. Right? You may have all the drugs delivered in all community health centers, but still not make a dent in reducing infant mortality rate. Okay, the last question here. How will you know that when you have been successful? In your own work, how do you determine when you have been successful, for example? I know some of you are in the budget ministry or the financial ministry, so you're not really involved in the field implementation of the project. But you must have some indicators that you use in your country to monitor how well the budget or the finances given to the field implementing agencies make use of that budget. What kind of information? How do you know? How do you know? Sometimes our incentives as budget officials or finance officials is the moment we're able to release the money, our job is done. Right? It's how well you can transfer the money to local governments, for example, or to other ministries. Then as far as the finance ministry or the budget ministry is concerned, this job is done. But that's not enough, right? I mean, for all we know, for example, this is a usual problem in the Philippines. We make a lot of transfers to local governments, and then that's it. We forget how the local governments spend the money. Well, they spend it on a lot of things, right? We have a favorite saying, it's KDL, it's Kasal, Binyag, Living, which is in Tagalog, which means they spend it for wedding, for christening of their children, and for burial. All these social welfare, supposed to be social welfare activities that are not really government concerns to begin with. There are other things you can spend government money on, right? For health, education, infrastructure, so forth and so on. But and yet, local government officials are not spending as much on those things, and they spend it on, shall we say, patronage. Okay, so as far as finance and budget management official, should we say that our work is not simply because we have transferred the money? No, right? I mean, we should also be concerned about how well that money is spent. That is why more and more now, I think that we're adopting what we call a performance-based grant system, budgeting system, right? It's not enough to choose that the local governments get the money. They should also report how well they spend the money relative to pre-agreed targets or goals or objectives, for example. And on the basis of those achieved results, then you make a determination whether to increase their grants in the following year or reduce the grants in the following year, or change the grant format from a block grant to, for example, a conditional grant. If the block grant is something like you just give the money and then they are left to spend, it's just like free money. A conditional grant is something like you get money conditional on them performing or doing something. So the money is not free, that they can use however it pleases them, but only for certain purposes. That's the conditional grant. Okay, so more and more reforms are going to that direction. I mean, performance-based budgeting or performance-based grant system. But it begs the question, it begs the question in the sense that you need information on how well they spend their money. How well they spend their money here means relative to the targets. You know, are they achieving those targets? Presumably with the money that they get from the central government. Okay, for example, again, I've done a lot of work on health sector in the Philippines as well. Examples are always on health. So we have a performance-based grants to local governments. Just to get back to what David said earlier, we decentralized our health sector. So a lot of hospitals and health workers, doctors, were assigned now to the local governments. So the local governments are now in charge of running the local hospitals and managing the local health workforce. Okay, the assumption that they are better than the national government in terms of designing the appropriate health intervention which is needed by their own constituents. So in addition to the decentralization of health functions, we gave them money as well. I mean, they got additional money from the national government. But the money that was given to them is in form of a block grant, which means it is not tied to the devolved health functions. So you give them expenditure functions, which under autonomy they're left to do whatever with the health functions. You give them additional money, which is not tied to the health functions. Again, they can use it however they want. So what happened? Well, they did not spend it. That's what happened. Well, one excuse is that, well, under local autonomy, they should be left to do whatever they want. That's the presumption under local autonomy. But 20 years, that happened in 1991. 20 years later, when we revisit the issue, you ask the question, did we do the program well? I mean, we expect them to become more responsible, more accountable to the local voters by giving them more money and more expenditure responsibilities. And look what happened. Some were successful in what they're supposed to do. They have better hospital services, they have better workers, but a lot of them came out worse than before decentralization. So what it means is that while in the budget or finance ministry, it's okay to deliver the money, the health ministry says we assign the functions to you, we leave it up to you. 20 years later, when we assess what happened after the 20 years of decentralization, did we make the right decision? That's a kind of policy evaluation or program evaluation that we pose after some time. While we agree in principle that decentralization would make sense, the way we did it is not the right way, or is it the appropriate way, or is it the most suitable way for our culture, for our circumstances? Then, maybe, from hindsight, we always talk with wisdom from hindsight. The better way to have done it is to tie the money to the health services. Or they only get money based on some performance targets. They're not simply allowed to do whatever they can. They should still be held accountable in terms of delivering results or meeting targets. And conditional on them meeting those targets or results, then they get money. I mean, that's the kind of lesson that we have learned in the Philippines after 20 years of centralization. Okay, but we only able to do those make assessments if we do evaluation, right? So the next, of course, the next battle will be in changing the local government code, or amending the local government code based on these results. But at least now we know what directions to take. So those directions wouldn't be so obvious now unless we made the assessment. Okay, this is an example of, well, this just serves to illustrate how to link results monitoring to outcomes. So you have target 1, 2, 3, for example, and then all of them links to the outcomes. Just going back to my reduction in infant mortality story here is that we know that there are many ways to reduce infant mortality rates, right? One of them is just immunization of young children. But even if children are immunized, there are other factors that may contribute to high infant mortality rate, right? Like, for example, accidents or diseases that are not preventable by vaccines. Diarrhea, for example, remains a top killer of infants in the Philippines. But that is not vaccine preventable, right? Some causes of diarrhea would be due to food poisoning, for example, or contaminated water. So the appropriate intervention there to reduce diarrhea incidence would be water and sanitation intervention. So that would be, for example, means and strategies to achieve target 2, reduce childhood diarrhea. The first one, target 1, is achieving a 95% immunization rate. The second one is reducing the incidence of child diarrhea. The third one, can you think of another one that will help contribute to reducing child deaths? In your country, what would be the top causes of child death? In my country, it's just the diarrhea and then the vaccine preventable diseases, polio, other things. I remember, it's been sometimes since my kid has his immunization. There are usually 5, diphtheria, tetanus, polio, that's DPP, and then there are 2 other ones, I think, vaccine preventable diseases. Then diarrhea, and then what's the third one? I don't know, bad parents. Oh, okay, so you educate the parents, right? I mean, in terms of good health practices, maybe hand washing, toothbrush, taking care of the surrounding, right? To get rid of mosquitoes, so forth and so on. So these are the things that are designed to educate the adults in the household on how to take care of the young members of the household. So all of them contribute to the reduction in infant mortality rate. But each one of them would have their means and strategies. The device that is needed and the budget requirements, the human personal requirements needed, for example, in ensuring that 95% gets immunized may be different of those that are required in reducing diarrhea. Diarrhea would be more of water and sanitation and hand washing, different kinds of immunization. Mothers, oh yeah, okay. The maternal health as well has consequences on the child, especially when the mother is pregnant, right? Yeah, that's right. You cannot separate infant health from maternal health because a lot of the nutrients that the unborn child gets comes from the mother. So the mother is not healthy, is smoking, is drinking, is taking drugs, or doing arduous work, or take real situation, then the child's health will get compromised. Yeah.
As I said, I think it's one very important issue is access to clean water, because all these disasters, it's related with clean water. Depends what do you drink, what do children drink, for example. That they wash their hands, and that's.
Yeah, I agree. Water and sanitation are very important programs in reducing, well, more directly child diarrhea, which contributes to morbidity and mortality. Yeah, correct. In fact, I'm going to talk about water and sanitation more later when we talk about this. Yes. You wanted to say something?
I just wanted to add that this is the general environment is.
Yeah, for example, accidents, pollution,
Yeah, exactly.
it's a stressful environment, or conflict, legal environment, all of these things.
I was saying about pollution.
Oh, pollution, yeah. Yeah, pollution, I could say that they contribute to asthma, the chronic obstructive pulmonary diseases. They cough a lot, they develop asthma, they have all sorts of lung diseases because of pollution. Is it a big issue now in the country? Which country are you from? Is pollution or asthma or pulmonary diseases a big problem in children?
It's not big diseases in our country, but I think it's very dramatic issue in the world.
Yeah. Well, the Philippines, in urban areas like Metro Manila, we have a very high incidence of what we call the chronic obstructive pulmonary diseases, which is asthma, continuous coughing, because of pollution in urban areas. Yeah, you're correct. What, sorry?
Can we ask quick, I have some monitoring and evaluation.
Yeah, I just have one more slide, but basically the same thing. Sometimes, just to say here that sometimes to achieve target 2, you would need different components working together. That's basically just what I'm going to present. So, yeah, but that's it. That ends the slides. So yes, please, you can start.
I was in Russian. У меня вопрос. Вопрос. Мониторинг концентра, они должны быть тотальными либо выборочными, потому что сам бюджет, в ней может быть очень много статей расходов, и ее мониторить постоянно очень сложновато, например. Только реализация около, может быть, 20 тысяч проектов разного уровня, и у меня такой вопрос. Мониторинг центра, она должна быть тотальная, то есть все подряд, либо должна быть выборочной.
You're correct that sometimes to achieve target would require different agencies, different people working together, hand in hand, coordinated manner. So monitoring each one of them could be very difficult. So his question, as I understand it, is that what then is the best way to monitor all of these different components? Because there are 20,000 units working together, required to work together to achieve, for example, reduction in health outcomes. How would you then do the monitoring? Well, often the answer is you decentralize the monitoring to begin with. For example, you can do that by area. So if you need to reduce, for example, the infant mortality rate overall in the country, so you have monitoring in region 1, region 2, region 3, region 4. And then the information that gets upward to the central level will be by on a region basis rather than a per area basis. Otherwise, the information required by the central wouldn't be collected. That's one way, I think it's you decentralize.
Another.
As Dr. Kumula mentioned, monitoring happens at different levels by different government departments. Now, when we're monitoring, you can monitor many things. You monitor the inputs, you monitor how much you spend, you monitor activities, you monitor outputs. What we've actually found is when we're trying to implement a monitoring system is that at different levels of results, you have indicators. Okay? But what you do is that you decide that, for example, input indicators, you decide on one or two indicators that are the critical indicators that feed into the next level of decision making. So, for example, if you are spending, if you're looking at an indicator to measure how much you've spent on various things, you might actually say, I'll have an indicator to say how much, I don't know, just take an example on say, schools, building schools. If you're looking at trying to monitor literacy, you might have an indicator to say how many schools have we actually built? Or how much money have I built for schools? You choose one or two indicators to the next level of results. And that's the only way you can effectively monitor. You cannot monitor lots and lots of information and think that you can make a decision out of it. You have to, an advanced side, in a sense, how are you going to filter all that information up to the decision making? So monitoring has to take place. The critical decision is not how much monitoring, it's how to use the monitoring for decision making.
Спасибо. Я как понял, то есть выборочно. Второй вопрос у меня такой. У нас, как я понял, то есть у нас мониторинг это осуществляется в период реализации. Оценка осуществляется по итогам завершения. Но вот в одной из ваших слайдов я заметил, что на самом деле оценка проходит даже в период реализации. Вот где confirmation roles of results based on engagement. На этом слайде было написано, что оценка реализуемых мероприятий было написано, то есть как бы процесс еще идет, но мы уже что-то пытаемся оценить, хотя оно может не завершено. То есть двоякое понятие, по-другому. Потом, у меня такой вопрос. Мониторинг осуществляется ли на краткосрочные мероприятия, более или менее, они такие затратные, но период реализации, скажем, меньше 6 месяцев. Там очень короткий период времени, в котором очень, во-первых, мониторинг проводить, она отвлекает исполнителей, потому что это даже надо писать отчеты, форму дополнять, отдавать тому лицу, которое это мониторит. Или все-таки краткосрочные мероприятия без мониторинга только проводятся оценки.
The way I understand this question is that monitoring is done while the project is being implemented. So, on one hand, the monitoring activity can be distracting. It takes away time from the implementing the project itself. I think the question now is who should be doing the monitoring? Is it the project implementers themselves or a separate unit within the same agency that implements the project? Or is it the same person altogether? Is it the one who implements also monitors himself? I think what happens is that the implementer has to submit certain reports, right? And then submits them to somebody within the agency, either the head or the monitoring agent, the monitoring person. Put all this together, summarize them, analyze them, and report them to the head of the agency. Yeah, I agree that doing your own monitoring when you implement a project can lead to types of problems. One is it takes away time for the implementation, and at the same time it also leads to conflict of interest issues, right? I mean, if you're monitoring yourself, you're less likely to report the whole group. Right? And there's always that tendency to collect only those things that make you look good. I'm not saying anybody in particular, but the human tendency, I think that what you do is all monitoring. Maybe there's something to share.
A very short comment to Joseph Hogan. I first want to say I'm finding it really valuable to listen to what you're saying, because it's putting meat on lots of ideas that have been floating around like days, and it's been a sort of development of those ideas. But just in response to this question, it's very interesting, and it is very expensive. One of the last things I said, you guys, I mean, was the results-based framework, proper monitoring, proper accountability takes resources. But they're not wasted resources, they're critical resources to ensure that the results are being achieved. I mean, any system, any factory, any productive system will put in Q&A, quality assurance arrangements to make sure that they're producing the right things. The other comment I would make is that, especially some of the low-level monitoring that Joseph's been talking about, the operational, well, I've been calling the operational level, the manager needs, the person doing it needs, not just the high-level managers, etc. I mean, how can they really do their business without monitoring critical things? The question is not but what I, as a day-to-day manager, need to know is the same as what my security knows. So it should all be together. It should not ever be considered a resource that is other than adding a lot of value.
Такой вопрос. Просто он может даже не вопрос, а коммент, как обстоят дела у нас с мониторингом и оценкой. Да, у нас мониторинг проводится сейчас, в данный момент, почему назову тотальный или нет. Мониторинг, он идет у нас тотальный. Тотальный он происходит по следующим причинам, но он проводится у нас 2 раза в год. По итогам первого полугодия, по итогам этого. То есть мы в период реализации никого не отвлекаем. По итогам завершения 6 месяцев Министерство финансов проводит оценку реализации. В первую очередь это зависит от кассового исполнения. Есть план финансирования, насколько выполнен план финансирования и насколько это потом проверяет факт исполненных работ. Но это делается тотально, для этого Минфин сам это лично не делает, для этого имеет отдельное юридическое лицо, который сидит на государственном заказе, который имеет право запрашивать отчет. В период этого мониторинга просто многие жалуются, что их отвлекают от деталей некоторых, представить информацию, что она лишние трудовые ресурсы отвлекаются, которые должны на самом деле, там, скажем, первое полугодие приходит на лето, у нас зима, и там сам разгар работы идет, и трудовые ресурсы отвлекаются. Это одно. А оценку мы проводим по итогам года, то есть проходит полгода уже, год проходит, по завершению года через 4 месяца мы делаем оценку реализации мероприятия. То есть уже по факту, что есть. При этом по оценке у нас тоже такой нюанс есть. Очень трудно провести такую твердую, внятную линию между мониторингом и оценкой, потому что мы говорим, что мониторинг — это реализуемые мероприятия, а оценка уже завершенная, имеющая конечный показатель, по которому можно будет оценить. Иногда бывает такое, что вот построить школу, строительство школы, это, то есть само здание, это не показатель. Да, есть это конечный результат, но эффект же должен быть же, насколько она обеспечивает, там, сколько покрывает школьников, сколько это можно оценить только после того, когда она, скажем, зайдет в проектную мощность. А это надо будет оценивать уже через год, то есть не через 5 месяцев, а возможно даже через год, либо через 2. У многих мероприятий такие расходы, из которых эффект не виден. Выплатил деньги, это не означает, что все уже, то есть завершил, и спрашивать их, что они сделали на эти деньги. А там надо будет уже отсрачивать. И вот это планирование вот этой оценки очень трудно дается вот, в системе вот этих вопросов. Именно вот само планирование, когда у каждого рассчитать. Потому что возможны такие расходы, которые у одного надо будет проверить в этом месяце, и по этому же вопросу к нему уже прийти через 6 месяцев, чтобы оценить другой результат. То есть один объект проверяется по несколько раз, ну, тоже, соответственно, проблема, учитывая ресурсов, финансовые расходы. Там еще у меня есть, если у вас, конечно, методика вообще, как считается, если у вас есть методика от проведения вот этих вот, сложных проектов, оценки проведения, которым надо на несколько раз повторить, в том числе и вопросы по оплате, если есть. Спасибо.
The way I understand this question is that what could be the optimal timing or schedule of monitoring? And then the one I think is about the scope. Suppose you have several school building programs. You have to establish, say, 60,000 school buildings all over the country. Do you monitor each one of them, or make a sampling only? And when do you do that? Is it in the first month, the third month, fourth month? And who should be, who should do the monitoring? Is it going to be a third party, independent monitor that will do this? Or it should be the implementers themselves that should do this? And then how much information should they require? Because if they require so much information, then you know those in the ground level might have to do just providing the information that the monitors are required. Say for 1 week, 2 weeks. I think this is we haven't touched that in the slides. The timing, the scope, and we should be doing the monitoring. I think very important. We should be
yeah, I think what you raised is a very common issue that is common on all our projects that we face in implementation with the development bank and through some of our also work as well. The critical thing is that we shouldn't regard monitoring and evaluation as something that is going to be judgmental on the internet. Once they think of it like that, they're not going to want to do it. The second thing is that the agreement of how to monitor and how to evaluate, what we call the monitoring framework, evaluation framework, should be established at the outset. And what I mean there is that at the beginning, there is a consensus about what monitoring information is going to be collected, how it's going to be used, who are the people who are going to be engaged in the monitoring, who's going to undertake the evaluation, and as Dr. Kapoor mentioned, the timing of it as well. So if this is understood in advance, that also helps the ability to plan for the resources, which is something mentioned and as I mentioned before, the course of open monitoring framework, you actually then make a decision. We had a workshop in Bangladesh. We had an independent, the planning ministry said that, okay, we established the plans, but we would like to monitor the implementation of the plans. So we got the planning ministry, implementation unit of the planning ministry together with the sector agency, health, education, etc. The planning agency said, well, we're supposed to receive information from the sector agencies in order to be able to assess whether the plan is progressing. But then they also added, well, we don't actually trust the sector agencies because they're obviously going to want to show that they're doing well, so therefore we can't trust that information. And therefore, as what they did was they went back to the government and they said that we, the planning agency, we need to have doctors, we need to have engineers because we want to go and independently collect the data. Now this was a situation where basically the planning agency and the sector agencies were in disagreement. And because the sector agency said, we know how our projects are being implemented and we will provide information, the planning agency said, we don't trust you. The question for the Ministry of Finance is that how much resources are we going to put to monitoring? On one hand, the sector agencies are going to monitor, at the same time the planning agency said we don't trust them. They had to come to an agreement to say that the sector agencies will provide the information, But the monitoring agency, the planning division or planning ministry, will actually monitor different indicators which are related to the same issue. For example, let me just take an example of literacy. The sector agency, which is the education ministry, is going to provide information on the number of school buildings and the number of teachers trained. But the planning agency will actually monitor the indicator on literacy, because they will do an independent literacy test and they will go. And if the literacy rates were not going up, then somebody would then have to question the sector agency, saying, okay, you did build 3,000 schools, you did train 10,000 teachers, but where has the impact? Now that's not to give blame to the sector agency, it's basically to analyze, as you said, the cause and effect between where should we be spending our money to improve literacy. But that is a discussion that had to take place at the country level, and every country has to come to some agreement about who's going to be doing the independent monitoring, who's going to be doing the independent evaluation, and who's going to be collecting the data.
And the cost of those things.
Yeah, and obviously you have to factor the cost of very often the cost of evaluation and monitoring is not factored in. And this is something that has to be factored in. I think traditionally about 5% has to be at least given, or 5 to 15% has to be given to the monitoring and evaluation.
First of all, I would like to say thank you, Professor, for your presentation. Very interesting and very wonderful. Okay, you like. Can I speak in Russian? I think my Russian better than my English. Okay. Насчет мониторинга во время проекта, во время происхождения проекта. Это очень, в смысле, думаю, нужная вещь. И этот опыт мы имеем. Вот вы почему забываете, например, опыт того же Азиатского банка, того же Всемирного банка. Значит, ну давайте я скажу, как у нас станет. И если донор определяет деньги, если опыт, то во всех странах является. Это же тоже является мониторингом. Когда разные миссии, доноры приезжают в вашу страну, они смотрят, как проходит проект, и так далее, наоборот. Они ведут оценку проекта. Это тоже является мониторингом со стороны донора. Со стороны Минфина, уважаемый Владимир Михайлович, Минфин тоже выделяет средства, и она должна на самом деле контролировать, правильно ли их средства, есть ли эффект от этого, в смысле, проекта или нет. Поэтому мониторинг во время проекта это очень нужно. Не обязательно его проводить в конце и заключать итоги. Итоги могут быть совсем даже и уже, как говорится, нам могут не понравиться. Поэтому нужно проводить мониторинг во время проекта, чтобы знать, мы идем по правильному пути или нет. Поэтому этот опыт мы уже имеем со стороны Всемирного банка, со стороны Азиатского банка, это очень хорошо. Пока мне очень нравится. Они вот контролируют, как делать все. Это даже помощь значит, правительству в том, что это как бы является и контролем за проектом. Потом, я хотел бы, меня вот очень интересует одна вещь, вот вы затронули вопрос переселения населения, бедного населения на Филиппинах. Я был на Филиппинах 3 раза, я был на Филиппинах, я видел все это, если честно. Да. Это, я думаю, это является великой проблемой на Филиппинах, потому что переселение народа именно из центра в окраине. Просто вот хотелось бы узнать, когда вы думаете переселять вот население на окраине, вот правительство выделяет какие-нибудь льготы или средства, потому что народ, я как знаю, всегда рвется в центр. Центральные города, ну, Манила. Но Манила делится, как я знаю, на 9 городов, мелких городов. И более яркий, более там, как говорится, я извиняюсь, конечно, не как смотря как композит вопрос, более, ну, скажем, светлый, это Макати-Сити, вот, как я помню. Ну, как говорится, народ всегда рвется, но он не такой уж большой, чтобы смысле. Поэтому мне хотелось бы узнать, вот как правительство хочет решить этот вопрос с переселением, потому что народ, когда думает, не очень хочет переселяться на окраине, потому что этому также и способствует там природные явления. Могут быть там землетрясения, я не знаю, бывает, но цунами, по-моему, бывает на Филиппинах. Они боятся этого. Спасибо.
maybe Persona will share about maybe monitoring activities. The country does speak more on the resettlement issue in the Philippines. He said he was asking, he wants to know more about the resettlement programs in the Philippines because he's been there in the Philippines and has seen a big problem, at least, especially in our financial district in Pati. A lot of urban slum dwellers in those areas. And it's right to think that these people are in the urban areas because they like it to be there, right? There are laws, the public services are better, the work opportunities are there. So you just resettle them to another area without the same opportunity, without the same public services, or without the same access to livelihood, so forth and so on. They will just go back to the cities, right? They will return. They will not leave the city. They will refuse to follow government orders. That's exactly what happened. In the beginning, during Marcos times, we forcibly relocated them to areas. Whether they like it or not, somehow we managed to relocate some of them. But under the new administration, they've done several ways to relocate. One is just providing new areas, okay, with subsidized housing, with improved community facilities. But then only find out that that's not enough, right? Because if there's no work there, if there's no livelihood opportunity there, housing is not going to, providing them new houses, it's not going to solve the problem, right? Because they just go back. So I think now more and more the government is realizing that in addition to the physical houses that you provide to them, you have to provide work opportunities as well. That's a more challenging part. Right? What kind of opportunity can you provide in the system? If you don't have an opportunity to begin with this in the city, how do you make a city out of this resettlement areas, right? It's very difficult. Well, one way to do that, I don't know if the government has done it, one way to do it is that maybe resettlement area more accessible to the urban areas, so that they can still work and then shorten the traveling hours. So they can still work and still be in the resettlement area. Quite apart from providing them their own economic opportunity. I think that's one solution. The other problem as well in Manila is that the local governments are very generous in helping the poor. Like, for example, in Makati, right, they provide free movie tickets, free education for their kids, so forth and so on. Of course, this will attract the poor in the areas, right? The beneficiaries are the poor, then the poor will just move to where these public services are provided for free, or generously, so forth and so on. So, and then the politicians, which are locally elected in the Philippines, would of course want these more voters. Well, it's very hard to solve the urban resettlement problem in the Philippines unless you have a very coordinated approach between the local governments and then the national government. I think this is some of the political economy issue that David was talking about. The resettlement intervention alone will not fly. It will not improve lives if you don't talk about the circumstances or the political economy that makes these urban squatters proliferate in certain places. Because they are also voters, right? So the voters, both the local government, they say, well, we want to stay here, we don't want to be relocated, the more relocation program will be successful. Unless you take control away from the local government. That's an intergovernment issues problem. We as implementers, as monitors of programs, can only do so much to solve that problem. I mean, that's my take on the settlement problem in the Philippines. It's still a big problem. If I may just contribute a little bit more to what Persona said to your question, is that I think the timing of the intervention, the timing of the monitoring depends partly on critical points at which during which the program is implemented. Critical points, for example, if we're talking about budget, usually you find the monitoring by percentage of budget spent, right? 30% or 50%. Because the idea that once the money is wasted, you cannot claim it back. It's too late by then to improve on the program implementation or design. So I think that's one of the key indicators or key drivers or critical points that donors are watching out for when they do missions, right? Implementation missions. How much of the budget was actually spent already or needs to be spent in the second round? Because if the previous amount was misspent, then we don't want to bring more money when that is misspent. Second is that you don't want to monitor all inputs, all activities, right? Or all implementing agents. Again, it depends on the purpose of the intervention, right? If you, the purpose of the monitoring, if you want to monitor, for example, the overall performance of the program, you can do monitor of selected areas or selected units because you want is an overall assessment of what is happening. But you can be very localized as well. For example, if you find that from your general observation that certain areas are lagging behind, then you may do more intensive monitoring in those areas. You don't need to monitor all. I mean, it depends on the need of the monitor as well. Then you can actually collect all information. For example, has the bid contract published? Have you solicited enough bidders, private sector bidders, and evaluated the bids properly? Sometimes you can leave it to the ground level managers to take care of it. And the higher level manager will simply ask whether this has been contracted out or not. And if not, then that's when we need to do a more detailed questioning of the project implementation. So again, it depends on what the needs of the program managers are. There's no we can how do you say, guide rule for determining the scope, the timing, the levels of monitoring. It depends on the need of the program manager. But usually it's something like how critical is the information needed for the next phase of the program, or in relation to the target, or in relation to the duration of the program. So you don't do monitoring. You don't monitor a 2-year program at the end of the 24th month. By then it will be too late. You need to time it, maybe quarterly, it depends as well. Am I making sense?
From the perspective of agencies like ADB, the World Bank, monitoring of our projects is something that is becoming quite critical, because we also want to show that our intervention is making a difference. So this is the question that we're always facing. We're wanting to put a road project, say in Tajikistan, and we think, well, we're not so sure about the government systems, but we need to be able to monitor this project. So what tends to very often happen is that we create our own monitoring system for the project itself. The problem then arises is that when we want to then get data for the project, we go to the government, because the government is implementing. And then the government says, well, it's a lot of resources to actually get this information. But very often the government has to provide the information because that's one of the I guess, conditions. And then a lot of effort is spent providing that information, and ADB then make a decision as to whether or not the road project is successful or not. But when the project is completed, the whole monitoring system disappears, because it's only really established for the project itself. And so then what happens is when we want to implement a project again in a few years' time, a road project, we don't have access to that information, and we start to rebuild that information again. So this is the problem that development agencies always face. Should we set up our own monitoring system? Should we use the monitoring system that the country has already in place? But then what if the country doesn't even have a monitoring system for the indicators that we need? Do we still go and establish our own monitoring system, or do we go to pick different indicators? And this is something I'd like you to think about. If you're ever in a situation when an ADB or World Bank project comes and talks about monitoring, well, what would you want to say to them? Go ahead and decide on your own indicators, and then we're supposed to provide you the information? Or do you say, well, let's now come to some agreement about what indicators we should use, and perhaps we should think about the indicators that we're already using and try and see how they can fit in to helping you identify whether the project is well. Because that helps to perhaps build up your own monitoring system. And if you don't have a monitoring system for the indicator, and you think it's a good indicator, then perhaps you should come back to the ADB and say, you need to help us build up this monitoring system as well as implementing this project. So the critical thing about monitoring systems from the donor projects is the sustainability of any kind of monitoring framework that we use in. And from my perspective, I would very much like to encourage you to question donor projects to the extent to which they expect you to establish separate monitoring systems and not use your own country systems.
Anything else? Like to share anything from the country or yes. Yes, please.
我想提一个问题，就刚才大家讨论比较多的就是我们的监测问题，我想问一个评价的问题。就刚才那个发言的，可能刚才那个是那个也有问过啊，就是我们在这个评价一个项目的时候呢，其实评价的这个结果，我觉得是非常难以实施的，或者说比较模糊的啊。你怎么样看待这样一个项目是否是好的？其中有两个问题，第一个问题就是。我们结果为导向的这样一个评价，那么我们最初可能会设定一定的结果，但是如果我们这个项目的完成的这个结果它也是好的，只不过这种结果和你刚开始设定的这个结果可能不一样，那么我们如何去评价这样一个项目的好坏？第二个问题呢，就是这个评价的时候呢，可能它有一个就像刚才那个问问题的那位先生也问过，就有时候它可能有个时效性的问题。那您刚说的这个评价可能是在一个项目结束的时候来去评价的，但有时候它的这个项目的实施的可能它的呈现的一个结果可能有一个阶段性，那么如何去处理这个实施的这个问题？比方说今天这两天这个小丹娜还有戴维教授都举过这样一个例子，就是教育例子。那么我们这个教育，这个可能会在某个地区设立一些学校，来去它的目的呢，就是说如果提高这个地区的这样一个教育质量。这是它的目标。那么我们在评价它的时候呢，可能这一个结果可能不一定能够体现出来，但是我产生的另一个结果，比方说，我降低了这一块地区的这个犯罪率，那么这可能就是刚我问的第一个问题，就是它的结果可能呈现了，但是它是不同的。那么如何去评价这个项目？还有，就如果它这个教育质量的提升，可能在项目结束以后，它可能显现不出来，可能需要5到10年。那么我们如何去评价这个项目的好坏呢？这是第一个问题。就是我们如何做一个好的评价的问题。第二个问题就是您刚说的这个监测和评价，监测可能是过程中的控制，而评价是一个项目结果的一个评价。那么监测和这个评价之间呢，它是否有联系？那么监测的这个指标和评价的指标是不是有相同之处？这是我第二个问题。谢谢。
Well, she's asking, one is that supposedly intended results are not achieved, but something else is achieved, equally beneficial. It's called the unintended beneficial effects. How then do you evaluate the program? For example, it's an educational program, still very few people finish education, but the crime rate, for example, got reduced. As a consequence of that intervention, maybe the children are spending less time in the system or in the school, but they are not able to go to the schooling. So how do you weigh then the intended beneficial effects to offset the unachieved intended results? Well, my answer is that in the beginning, you have to agree on what kind of results to achieve. Right? The extras are just extras. They should not be substitutes. Because there is a separate intervention for reducing crime rate. For all we know, education intervention may not be the most direct or the most effective way of reducing crime rate. That is not to say that we should then consider them exposed. Exposed, meaning once the project has been completed and you observe these unintended results, then they should be counted. But ex ante, they should not be the most, the drivers of the intervention. They should not be the drivers of the intervention. Because education is not the proper intervention for reducing crime rate. I mean, ex ante, you have to agree on the most direct outcome indicators that can be related to the intervention. Ex post, of course, there are other intended consequences, some beneficial, some less so. You all consider them when you do the evaluation after the project. But they should not be substitutes for developing a project ex ante. Right? Because sa Tagalog it means because, okay, because you cannot anticipate to begin with the intended consequences because they are unintended. Okay. Another one is that when is the right time to do the evaluation? Because some of the outcomes will change only after a period of time, after the intervention is completed. Right? For example, you want to reduce literacy rate, improve literacy rate, completion of basic education may not be enough. Sometimes you also need to be exposed to media or other factors as well before you gain a working level of literacy. Well, correct. Some indicators, some communicators are slow to respond to interventions. Some indicators are quick to respond to interventions. So she's right. You let the program manifest its full effect first. You give it a chance to have an impact before you evaluate it. For example, if you want to reduce the traffic to the road project, you have to observe it, say, after in a year's time or 6 months at least, to see if the traffic has improved because of the road intervention. You cannot do that overnight, right after the project. But you don't exactly wait for 10 years before you evaluate it, right? Because population rate growth has risen by that end, and the intervention will be effective before. Not because it wasn't effective in the beginning, but because there are more users 10 years later than one year later after the intervention. Right? And then one is that how do you piece out the effect of the intervention on the outcome when other things may contribute towards the improvement of outcomes? I'm going to discuss those in the next two lectures. The impact evaluation and methodology. That's precisely what we're going to do. How do you attribute the change in the outcome to the intervention and not to other things? Time already? Okay. Can I get started?
We have time after lunch to get some questions, so it's time for lunch.
Shall we get back to work? Okay. What I'm going to be presenting this afternoon will perhaps answer some of the questions I wasn't able to answer completely this morning. A lot of questions about evaluation, impact evaluation. Well, we'll make this more interactive. If you have questions along the way, you can ask them, clarificatory questions and all that. I know that sometimes I speak too fast or I don't really make complete sense, so you can raise your hands and ask for clarifications. Okay? Now, this lecture is the first of two parts on impact evaluation. So the first one is going to be an overview of what we mean by impact evaluation nowadays. You probably have encountered this in your country, especially the World Bank. I think recently also the ADB and some other agencies. Oh, sorry. No translation. World Bank and probably ADB and other donor institutions or agencies are now pushing for impact evaluation. When they say that, that's a little bit different from what we've been talking about evaluation this morning. So that's really our coverage this afternoon. So, okay, this is just an outline of what I'm going to cover in this session. The definition of evaluation and program impact, types of evaluations, and then impact evaluation, and then mixed methods evaluation. So here is the definition of the program evaluation. In this lecture and in the next one, I'll be using the words impact evaluation, program evaluation interchangeably. When I say program evaluation, I also mean impact evaluation. When I say impact evaluation, I also mean program evaluation in this lecture and next. Okay, so it is a study using research methods to collect and analyze data of the outcomes of a program. That is, it is a study to explain whether and how well a program or intervention is working and why. The intervention here is a project or a program that you introduce to derive an outcome or improve an outcome. Okay, so here's the definition of the program impact. It is the measured outcome with the project compared to the measured outcome without or in the absence of a project. So the key word here is, it is the difference in the outcome with and without the project. That's how we define program impact. If you remember your high school biology, okay, we did experiments, at least in the Philippines we did experiments. We chose 2 seeds, planted them in identical pot of soil. One is exposed to sunlight, the other one is not exposed to sunlight. And then we observed that the seed that was exposed to sunlight was growing faster. And then we conclude that it must be the sunlight that explained the difference in the growth of the plant. Okay, so the difference in the growth, that's the program impact here. Because what we're comparing is the situation with the growth with sunlight and the growth without sunlight. So if you're thinking, for example, of a reduction in infant mortality because of our intervention, which is immunization, you would compare the reduction in infant mortality rate in areas where we implemented the immunization program in a similar area, exactly the same as our area where we intervened, except that the other area we did not do the immunization program. Remember, we should control all for the other things. In my biology experiment, it must be the same seed, it must be the same part of soil, except that the only difference is the exposure to sunlight. So that's the kind of exercise that we do when we do impact evaluation. Okay, it basically answers this question, the extent to which a project altered the state of the world. It sounds big, but what it really tells you is that what actually contributed to the measured outcome. So there are different types of evaluation. They can be differentiated, for example, in terms of the type of data used, whether it's quantitative or qualitative data, whether the data was collected at baseline before the project was introduced, during the implementation of the project, called that midline, or after the completion of the project, called that the end line. You can also differentiate the evaluation by types of or subjects of data collected. Is it about the beneficiaries themselves? Is it about the comparator groups, those who have the same characteristics as the beneficiaries, except that they're not given the intervention? It can also be community. Sometimes, for example, the intervention is community-wide. For example, you have introduce a peace and order intervention. That cannot be just limited to a household level. It has to be community level, right? Whether the deployment of more police in an area to reduce the crime rate, that has to be community-wide rather than just household level, right? So intervention sometimes could be at community level rather than just simply at the household level. Okay? And then we can also differentiate evaluation methods by methods of data analysis. You could have qualitative techniques and then also quantitative methods. We're going to cover all of this this afternoon. So if you remember my example this morning about how do you define the inputs, activities, outputs, outcomes, goals, and objectives in my new farming technology program. Let's just read this one. Okay. So in 2009, the new government promised to increase agricultural productivity and improve the lives of 60% of the poor living in rural areas. So that's the problem that we just saw in 2009. So to achieve this goal, which means the reduction. Yes.
In the previous slide, there was like information before the implementation. Before. So how we? I don't know how we go.
Before the intervention, before the project, for example, like in this case, you see the information that you get is that a lot of farmers living in rural areas are poor. That's your baseline information. So you probably got that from a survey or from administrative records, the things that your local people are regularly doing. So that's kind of before information that you have. That's just the baseline information that you have. Before intervention, before the project. Before the project.
Is it training to collect information before the project evaluation?
Yeah, this is
okay, well.
No, in this case, well, if you're asking me where did I get this information, this is before the project. Before the project, before the new farming technology program was introduced, it was found that 60% of the farmers have lower productivity, and therefore they are also among the poor in rural areas. So that's the baseline information. Okay, that's before you introduce the project. Now, using that baseline information, you develop a project which you think will help improve the situation of the target beneficiaries. So the project that is being proposed here is what we call the New Farming Technology Program, which basically simply includes training the farmers to adopt a new farming technique. The training will involve classroom lectures, farm demonstrations, and also information materials distributed to them. So that's simply the intervention that we have. So we believe, for example, in the beginning that training them, giving them information, both train at the classroom level and at the field level, they will adopt the new farming technique, and that will lead to improved output. Okay, that's the intervention. Okay. So that's exactly what is done in 2011. So the target beneficiaries were enlisted and were recruited to participate in the training program. Okay? And then, by the end of 2011, the farm outputs of the training participants were measured. So that is like your end line. That is your end line information. So in the beginning, you measure their output. After training, you measure their output. The measured output after the training is called the end line information. Okay? So according to this report, the results, meaning the output of the training participants which means presumably there was an increase in measured productivity of the participants. Is the case? It's a very simple case material. You want to improve the productivity of the farmers, so you introduce a program called the training program. You conducted that early in the year. After undertaking the training, they went back to their farms, planted the seeds, adopted the technique, and then they harvest their output at the end of the year. You measure again the productivity at the end of the year, and you compare their output before program and after the program, and then you see an improvement. So basically, that is what is being said here. Okay, that's a very standard description of a program. Okay, that's just the new farming technology, right? I'm just going to use that repeatedly in my lecture today. I'll keep preparing it, but just to motivate again, sometimes we do ex-ante evaluation. Ex-ante evaluation meaning is that you try to anticipate the outcome. You make a projection of what is going to be the outcome of a project, even before intervening. We always do that, like for example in feasibility studies, right? If you put this road here, how much more shorter will the traveling hours going to be, right? How much more farmers are going to be going to markets to sell their output because of these new roads. Without building the road, you're just trying to project the likely impact. So we call that ex-ante evaluation. We do that all the time, right? To justify an intervention. But remember, an ex-ante evaluation has to have also a science into it, because it's the most dangerous thing to evaluate. You can always produce a good result, or you can always produce a bad result. So it's kind of dangerous because you're using what we call artificial data. You're trying to project what will happen. And forecasting, projecting are the most, dangerous thing. You can easily, meaning do it wrong if you're not careful with the ex-ante evaluation. But nonetheless, sometimes when we make investments, for example, we make projections about internal rate of return on capital, right, or the cost-benefit analysis. These are some kind of tools that we use to justify an intervention, an investment. But those are going to be based on projected increases in demand, for example, or users, or beneficiaries, welfare beneficiaries. Then we determine, for example, the cutoff. For example, the cost benefit should be greater than 1 or greater than 100%. Then if our projections satisfy the cutoff, then we say, let's proceed with the intervention. And that's the kind of evaluation that you can do ex-ante. But remember, ex-ante assumptions may not be satisfied ex post. A lot of things could happen between the project proposal and then project completion. I have a favorite saying, a proverb that says, there are many slips between a cup and the lips. When you take coffee, okay, there are a lot of things that could happen with the coffee before even it reaches your lips. It could spill out, so forth and so on. What it means is that given that short distance, a lot of things have already happened. What more in project implementation? 1 year, 2 years, 3 years. So you should anticipate all these unforeseen circumstances to happen. That's what the caution that we must take with us when we do ex-ante evaluation. Okay. Ex-post evaluation. So the project has been completed. Let's say, for example, that we delivered all the inputs, undertaken all the processes, and measured all the outputs. Okay, now we're ready for ex-post evaluation. The project has been completed. We let it, take effect, say, for 6 months or 1 year, depending on what the expected outcome is going to be. So we collected the data. And then we collected the data from the program beneficiaries, those who actually benefited from the intervention. And then ideally, what we do here is to combine the ex-post data with process indicators or processes evaluation. Okay, sometimes we ask what really happened, in the course of the implementation of the program, what really happened? Did we really identify the beneficiaries? Did they really participate in the program? Did they really make use of the training knowledge that they gained? And was there really an increase in output due to the program? So these are some of the process indicators that we use. Not only about the measured outcome at the end of the harvest season, but also a lot of things that have transpired in the course of the program. Okay, the vast majority of evaluations are what we call exposed evaluation by default, after. You might say, of course, all evaluation will be done after. But what is this thing called exposed evaluation? How is it different from any other evaluations? As it turns out, there's a very particular definition of exposed evaluation in the impact evaluation literature. Okay, I'm going to introduce a lot of new words, maybe not new to some of you, but in the impact evaluation literature now, they make a distinction between so many types of evaluation. So I'm going to be explaining them in this lecture. So this is the kind of exposed evaluation. So we observe the farm output in my new farming technology case study to be 1,000 kilograms per hectare. So that's the information that you get. Remember, in my new farm technology, they said in 2011 they measured the outcome and the results look good. And then you ask, what exactly is this result that look good? And then they give you this information. 1,000 kilograms of same rice per hectare. That is the output. Okay? So some evaluation will start with that, and they will be happy with 1,000 kilograms. It looks fine, it looks good, it looks okay. Okay? But what's wrong with this exposed evaluation? You don't know whether that's an improvement or not, right? Because
I showed you don't know how much it was before.
Yeah, correct. If the output was 2,000 kilograms before, then 1,000 doesn't look good, right? Could have been a deterioration in outcome. Or if the outcome was below but very close to 1,000, it's not much. Right? For example, it's a 990 kilograms. So it's just a 10% increase. That's not a lot to be proud of, right? So the exposed evaluation, as we define it here, is
Еще на примере предпроектной работы, да? Вот, например, оценка, да? Оценка вот самого проекта до проектной работы должна оцениваться, насколько процентов увеличится повышение урожая. После этого только определенный рост есть именно урожайности, качества конечного продукта, что мы хотим. Оценка до проектной оценка, после проектной оценка, анализ. Сравнительно.
I agree. You were saying that, well, what we should be measuring is progress. So progress requires two information, data points, before and after in this case. So one information, data point, doesn't really tell you anything much. As I said earlier, what if the before output is 2,000? Then 1,000 it's not really good, right? If the before intervention, the number is 990, 1,000 is not a lot, although it's an improvement, right? So, yeah, you're correct. So this alone does not tell us anything about the impact of the project. Okay? So that's the main weakness of an ex-post evaluation.
Я хотел бы еще один вопрос задать. Если у нас проектом предусматривается увеличение урожайности, но этого не достигается, но вместе с тем в ходе процесса достигается, скажем, такой параллельный эффект, увеличится качество производимой продукции и, соответственно, доходы все же таки растут, хотя килограммы не увеличиваются. Считается ли это положительным достижением? То есть в ходе, допустим, отсчета проекта, за счет совершенствования технологий, увеличится качество продукции, соответственно, цена на него растет. Или при изменении цен на рынке, допустим. То есть в килограммах, в количественном выражении, возможно, что никакого прогресса не будет, но будет прогресс, допустим, финансовая часть, то есть будет больше валовый доход от продажи тех продуктов, ну или производственного продукта, проекта, на который мы направлены.
was asking, suppose you were not able to achieve the quantity targets. It's not 1,000, for example, but they achieve something less. But they achieve one quality target, for example, the targets of the quality in output has improved, and therefore they were able to sell their output at a much higher price. Would that then be a good evaluation indicator, a good success indicator? My answer to that is that what were your initial targets? Is it about quantity or income? If your initial targets are about the quantity of output, then we should stick with quantity of output. Again, that is the intended consequence. That is the target. If you're saying there are unintended consequences, like for example, increase in income, okay, or improvements in other things, that's an unintended consequence. But if those are so important, they should have been made in the beginning as part of the evaluation outcomes to measure. Because the moment you start using unintended consequences as success indicators, you will be forgiving failures. Right? I mean, remember, the main target is to improve quantity, is to achieve quantity targets. If you're saying we are not achieved that, but there are other things that are beneficial, then you're just making the other things as an excuse for failure in that point. That's very dangerous. If you start using other indicators as a substitute for the main indicators, you will never see failures. You will never also see success. Because there are a lot of substitutes that you can use to excuse failures. So, if that was so important, then make them in the beginning as part of the evaluation indicators. Am I...
我有一个问题想问一下，就是我们在评价一项这个项目，它以结果为导向的，就是来评价这个项目是否这个成功。有一个问题可能是最后这个项目做成了，但它可能是因为很多因素构成的，不一定是我们推动这个项目所实施的各种措施来促成的。那么如何在设定这个指标的时候，去除这些可能不属于它这个项目推动本身所导致这个结果？从就是最终结果呢，能够准确的评价这个项目成功与否。
Yeah, her question is when the project starts delivering results, usually other things are also happening at the same time, in addition to the project. So those results are the product of our own project plus the other things that are happening at the same time. So the question is, how do we make sure that it is our project that contributed to that, rather than the other things contributing to that? Or, the other way to put it is, how much the total change in the result is due to the project, and and not due to the other things. So how do we control for the other things? Right? We're going to that. That's what we call the counterfactual. Establishing the counterfactual. What would have happened without our project, given that those other things are happening anyway? If those other things are happening anyway, and we have a measure for that, and we have situations where our project is happening, plus those other things are happening anyway, then we can compare the outcomes of the two areas. And then if we find that the outcome in our project area is greater than in those other areas, where all the other things are happening in both places, then the difference in the outcome could be due to our project. But we have to, you're right, we have control for the other things that are happening at the same time. So the search for the other things, other areas where the other things are happening at the same time, is called the problem of counterfactual. Looking for the proper counterfactual. We're actually going to discuss those this afternoon, how to establish the counterfactual. Okay, so the point simply here is that we can establish, whether the output is due to the program or not in this case, with just one indicator. So you've answered that. The merits, it's easy to collect, it's already there, but it has its weaknesses. It doesn't really tell you anything much about the contribution of the project to the output. Okay, so we proceed to the before and after evaluation. Data are collected before the program is introduced, and data are collected again after the project is introduced. And then what you do is compare, right? For example, before and after. So at baseline, the yield was 600 kilograms per hectare for the NFT participants, for the participants in our new farming technology program. After they have participated in the program, our measured output is 1,000 kilograms per hectare. And then we see a difference of 400 kilograms. Right? So there's an increase from baseline to a year later in the output of our NFT participants. So this is the before and after comparison. Okay. This is usually called, in the impact evaluation literature, it's simply called the outcome monitoring, but it is not impact evaluation. Okay, the impact, remember, is that what will happen without the program. So it answers the question, the before and after comparison answers the question, did the beneficiaries experience a change? Did they experience a change in output? Okay? Was the change in the expected direction? We were expecting them to have a higher output after the intervention, right? Okay, so the information that we get, the 400 kilogram increase in output, is not solely due to the program. There are other things that would explain why they experience a 400 increase in output. Like, for example, there was an improvement in the weather. In 2010, there were a lot of typhoons, so their output was low. In 2011, they experienced a very favorable weather. And then also, in that time, they experienced a training. So that's why you see a 400 increase in the output. Now, what then explains the 400 increase, 400 kilogram increase in output? Is it the training or is it the better weather? We don't know. We cannot yet determine from the before and after data whether the 400 is due to the training or to the better weather. Okay? So this one has its uses, but it doesn't tell you yet the impact of the training. Okay? So I'll skip that. And then what kind of information then do you need to evaluate impact? What if you measure the outcome in 2011 in areas where we have, well, the output of the NFT participate in the program in the same area? Presumably, those living in the same area experience the same weather, right? Except the difference is that those were not exposed or did not participate in the training. Our participants were also exposed to the same favorable weather. So we're now controlling for the weather effect. And now, except that our participants have training. So we compare those with and without training in terms of output. Okay, so that's exactly what we have done here. Suppose our NFT participants, 1,000 kilograms per hectare. Non-NFT participants, their output was 700 kilograms. So we take the difference between participants and non-participants in the program, and we say there's a 300 kilogram difference in productivity of the participants and non-participants. Okay? So this is called the ex-post comparison evaluation. Okay? Now, does it really tell us whether the project or the intervention contributed to the program? Remember, what we're controlling here is just the weather, right? What if the participants are different in some other aspects than the participants? Suppose the participants are more industrious, they work harder. Then you cannot just compare them to non-participants. If the non-participants are naturally lazy, surely they will get lower output. So what explains then their lower output? It's not because the participants had a training. but because they were hardworking, and then the non-participants are naturally lazy. So it doesn't yet, again, tell us how much of the 300 is due to the training. Okay, so using control, using before and after, does not really tell us completely whether the project contributed to the output and by how much. Okay? So I'll skip that. Okay, suppose, so before and after information is insufficient, with and without information, without training is insufficient, exposed. But what we have, suppose we have data for both the participants and non-participants at baseline, and data for participants and non-participants at endline, after the project. So we have 4 sets of data. What is the output of the participants before the training, output after training, output before training of the non-participants, and then output of the non-participants after the training. So that's what we call, those are the numbers, for example, that we have. So before, in 2010, the participants' output on the average was 600 kilograms, right? After the training, 1,000. So there's now an increase by 400 kilograms. Among the non-participants, non-NFT farmers, their initial output was around 400 kilograms. And then a year later, it went up to 700 kilograms. There's an increase by 300. Okay? So we subtract the increase of the non-participants from the increase in output of the participants. That's why we get the 100 there. That is called the difference in difference. Result. Okay? So, in this case, what are we doing here? We're eliminating those factors that are common to both participants and non-participants that could help them improve their productivity, like weather. Since the participants and non-participants are exposed to the same weather, we take that away already. Okay? But since the participants may be different from the non-participants in other aspects, like for example, hard work, then we eliminate that in the first difference, the before and after. So in this case, the real increase in output due to the program it is only about 100 kilograms. All the other factors, all the other increases may be due to other factors. So that's a kind of impact evaluation that most donors are now pushing for. Right? How much of the observed 400 is really due to the program. Okay? But this in itself is not yet a good or the real impact evaluation, because what if we told this story? Okay? So I have a trend of output. In 2011, you will see the green line, right? That's the trending output of the training participants. The red line is the trending output of the non-participants. According to my table, in 2011, the output of the participants is higher than the non-participants, right? So we have the gap in the two lines there. In 2010, there was also a gap in the output of the NFT participants and then the non-NFT participants. Okay? And then we say the difference in difference gives you an estimate of the impact of the project. The 100 kilogram difference in difference estimate as the impact of the project. Now, what if we told a story that, to begin with, I just extended the story backwards in 2009. Suppose we were told the information that, in fact, in 2009, the trend was going down for the non-program participants, the program participants. But for the non-program participants, it was, on the uptrend beginning from 2009. So this one tells you already that maybe the participants are different to begin with from the non-participants. So the non-participant, any non-participant cannot just be a proper comparison. minority participants. Because what this tells you, they are really different from one another. So, any non-participant is not necessarily a proper counterfactual. Remember, the counterfactual is what would have happened to the participants had they not participated in the program. But the problem there is that you cannot be in two situations at the same time, right? You cannot be both a participant and not a participant at the same time. You have to be one or the other, right? So what we do there is that if you are a participant, we match you with another farmer with the same characteristics as you are, but who did not participate in the program. And then we measure your output, and then this measured output will be your counterfactual. That's basically the story there. In my high school biology experiment, the counterfactual is the seed or the plant which was not exposed to sunlight. Right? Remember, even if it's not exposed to sunlight, the plant will grow. It's just that it will not grow as fast as when it is exposed to sunlight. So, what will be then the contribution of the soil or the genetics of the seed to the growth of the plant? Well, that is the growth that you observe without the sunlight. That is the counterfactual. Had it not been exposed to sunlight, what would have been its growth? Well, exactly the seed which was not exposed to sunlight. So basically here, the same analogy here. We should, if you are a farming training, a new farm technology participant, I need to match you with a farmer who has not participated in the program, but had the same characteristics as you are. And then observe your outcome by 2011, and then make a comparison. That's the impact evaluation. Okay, so we have exposed, before, after, we have exposed comparison, without difference. All of this will give you some measure of the difference in the output of participants and non-participants. But not all of them will give you the right measure of the impact. Am I making myself, do I make sense? Okay, so let me just proceed. Yes?
Вопрос относительно уровня групп. Часть они стоят изначально уже чуть выше. Вы имеете в виду, что они до этого участвовали в таких программах, так как если судя по вашим графикам, можно понять, что на исходной позиции участия они и так больше продукцию выпускали. На неучастие, конечно, соответственно, меньше. Здесь, получается, вы участники, те, которые уже участвовали, и которые больше собираем, вы их же обучили, участники остались на тем же уровне, который не спеша, соответственно, поднимается.
The way I understand your question is, you're saying maybe the participants have other previous training programs to begin with, and therefore that's why that explains their differences at baseline. Yeah, it could be. That's why you need to compare them with other farmers who had the same training previously. So what you want is to be able to compare them with farmers who are also at that level of productivity at baseline. Because if you say that these are different because these ones participated in another training program, then of course you're correct. Then these are not the real counterfactual because they are different to begin with. So you're right, the real counterfactual comparison would have to come from the same group as these ones. They should be similar at baseline. Otherwise, you're not really controlling for other factors that differentiate your performance. I'm going to that in my other slides. I'm saying exactly what you said. The counterfactual should be those also here, and then you just measure the output after.
我还有一个问题啊，这是表示，在看这个图的时候，您刚刚说的这个我们基线数据是同质的。我有一个问题是在之后，就我们测量2011年，比方说它的差距，通过那个 被差法，我们知道它的差距就是这个项目的结果是100。但是比方说，如果2012年的话，它可能会有不同的差距，比方说200；2013年的时候，它可能变成400，或者可能变成50了。能不能考虑是不是从时间的角度来讲，就是趋势，然后我们给它做一个平均，是不是这样子可能更好？或者它成本太高？您怎么认为这个问题？谢谢。
The question I think is that suppose the initial difference after 1 year is 200, but it keeps on increasing year after year. Then, how then, which indicators are you going to use then, ex-post indicators? Well, it's all up to the impact evaluator, right? If you say the full impact can only be realized after 2, 3, 5 years, then you use the full 5 years. You don't have to wait for 10 years or you just limit yourself to 1 year. Because, you know, some things are, for example, immunization, right? Immunization. There's also what we call, in the beginning, you want to influence the mothers to come to the health centers to have their children immunized, right? But it's very unlikely that within a year, all of them will come. Some will wait to see whether the immunization is effective or not, right? That they will see other mothers who have done it and see whether it's effective or not. So you will have those trickle-down effects down the line. So what you do then is that you make a decision whether you evaluate first year plus second year plus third year, just to see whether the impact changes through time as well. You can incorporate time, but it's all up to you, whether you measure them year 1, year 2, year 3, or all years. The point I'm making here is that however you measure it after the intervention, your interest actually is what part of the difference is due to the program. Whether you measure the difference 1 year after, 2 years after, 3 years after, is something else. The important thing is the difference is due to the program. The years of measurement after the program, that's a different issue. The key is that how do you make sure that the difference is due to the program and not due to something else. Because you can even measure it 5 years, the difference that's still due to the program, you still don't have a good program. Okay? Okay, can I proceed now? Okay, this is what I'm just saying. Maybe the participants were different from each other, right? They have different educational background, they come from different family sizes, they have different motivation, they have different communities. All of these things contribute towards productivity. So you cannot just use anybody who has not participated as a comparison group to your training participants. Okay? Those are just what we call observable and unobservable characteristics. And the differences in these characteristics confound, meaning, what's another word for confound? Confound the estimated effect. You end up mismeasuring the true impact. That's the closest I confound, meaning the observed difference, the 400 that we see earlier, you might think that's the impact of the program, when in fact, the impact of the program is confounded by other factors. The true impact of the program in that example is just 100, but because of the other confounding factors, it looks like it's 400. Those confounding factors are the other observable or unobservable characteristics that contribute to improvements in productivity. That's what we use confounding. Okay? Okay. What could be the sources of these confounding factors? What we call selection bias. Suppose, here's an example of a selection bias. Suppose you ask somebody to see if the health condition in the country is getting better or worse. And you ask him to run a survey. hospitals. And guess what? What he reported? Well, the number of people getting hospitalized is increasing. Okay, is that a good result or not? No, because precisely because the respondents that you get in hospitals are sick people. So you did not actually observe the non-sick people who are not going to the hospitals. But your question is, your assignment to him is that whether the population health overall is improving or not. So if sample is limited to sick people, normally, of course, what we conclude, the sick rate or the sickness rate is increasing. But doesn't really tell you the big picture. So that's a kind of bias that we want to eliminate in the estimation of the impact. And there are two types of biases. One is the selection bias, and the other one is what we call the program placement bias. Let me just explain. The selection bias has something to do with the beneficiaries changing their behavior to be included in the program. So if you say, I'm going to distribute money to the poor so that to improve their health. Well, even the non-poor voluntarily volunteer to say that they are poor to benefit from the program, right? So that's a kind of bias that we want to control. Okay, we don't want that. Okay, the other source of bias is what we call the program placement bias. In my country, for example, if the government has the national government has an anti-poverty program, a lot of the politicians will say, you implement that program in my province, in my city, or in my municipality. Not because the people are poor there, but because the politician said that there are poor there, and therefore the program implementers are forced to introduce that program in that area. So there's again a bias there. It's a program placement, it's a selection of the program implementers or politicians or policy makers to introduce a program where they think it can benefit most. But usually those areas have other characteristics than poverty. Maybe they are voters of the politician. But not every poor are voters of the politician. So when you introduce a program there, who benefits, it's not necessarily the poor, but the voters of the politician. So if you say this is effective in that area, you cannot implement that in other areas, right? Because the other areas are not voters of the politician. So therefore, the success of the program introduced in the politician's area cannot be replicated elsewhere. Because the way you selected the area has bias. Am I making myself? So that's what we call the program placement bias. So the success of a program can be due to the beneficiaries themselves changing their behavior to be included in the program, or the program implementers themselves precedent the beneficiaries. In both cases, the true impact of a project may be due to those biases and not necessarily due to the intervention. So our task as impact evaluators is to take note of these possible sources of biases. It's good if we can measure them so that we can eliminate them, reduce, or take them out from the estimated impact of the project. If we say the 100 kilogram difference there is partly due to program placement, and we have the estimate of the program placement effects, 50 kilograms, then we net that out, we deduct that from the 100, and we just say, well, the real impact of the project without the program placement bias is just 50 kilograms a hectare. Okay? So, how do we eliminate selection bias? Well, it's usually random selection, where you randomize the experiment. Remember, I'll proceed. So you will have a treatment group and a control group. You have a seed which is exposed to sunlight and a seed which is not exposed to sunlight. The exposed to sunlight is your treatment group. Those that are not exposed to sunlight is your control group. Okay? But remember, in my biology experiment, the seeds have to be identical. Right? I mean, they come from the same plants, so the differences in growth cannot be due to genes. They have basically the same genes. And they're planted to the same type of soil. So it cannot be because of the soil. Okay? So you have a treatment group and a control group. Okay? And the treatment group and the control group should have the same characteristics. The only thing that will differentiate them eventually is exposure to treatment. In the impact evaluation literature, we use a lot of the medical terms like treatment. It's not actually treating them to get better health. Actually, treatment means here is exposure to the intervention. So our treatment in the new farming technology is participation in the training. So that's what we call treatment. The control group is those who did not participate in the training, but have the same characteristics as those who participated in the training. Okay, let me go ahead. Okay, so these are the sources of bias, self-selection and the program placement selection. Okay, here let me just define what is an attribution. The attribution is the extent to which the observed change in outcome is the result of the intervention. Meaning, what part of the observed change is due to the intervention. That is called attribution. Okay? We just attribute. Because any observed change cannot be due to the intervention. Only part of that may be due to the intervention. And that part that you can link to the intervention is called the attribution. Okay? So, we do rigorous impact evaluation to eliminate the biases and to make an attribution. Okay? Here, the important point here is that the counterfactual must be constructed here to overcome selection bias.
I have a question to ask.
Yeah. Let me start.
I just wanted to ask, this impact evaluation is based on the fact that you have a control group and that will be impacted by environmental issues. And the control group and the target group will be impacted the same way, and therefore you can accurately measure the effect of intervention by measuring the difference between the control group and the target group. How do we know, are we not assuming that the external factors will impact the control group and the target group the same way?
Yes.
We assume that it will. Is that actually the case? Can we assume that?
There are ways to test that.
Right, I just want to make sure. I was always concerned about that.
Yeah. Well, if you believe that...
Is that question clear? Agree?
What I say is that we are assuming that all the other factors that will have control affect the control and treatment groups in the same way. Because if they are not affected in the same way, then the measure differences to capture those differential effect of the other factors on the treatment and control group. Yeah, that is why we have to be very careful in selecting the control group. They have to be the same, at least in observable characteristics, as our treatment group.
Okay.
So for example, if you get lots of weather, they should come from the same place. Because if the weathers change from place to place, we cannot use residents in other places to be a control group.
The second question I have is that this exercise can only be really done in, just from my perspective, in very limited situations, because you can never really get the kind of control group in reality. I mean, if you're looking at, for a lot of interventions, for interventions like vaccination, you can, because it's quite clear that you vaccinate one group and it's impact. But for lots of other interventions which have, actually, it's very difficult to actually measure. So when we talk about rigorous impact evaluation, we have to limit it by saying that it can only really be applicable for certain kinds of evaluation. We really cannot do it for every kind of project. And also we should be careful that if we try and multiply, if we do it as a pilot and then say, this is the impact and therefore we can multiply the pilot for the whole country, we should be careful because there could be regional issues. That, I just want to know whether that's a limiting factor. It's kind of like China, if you do something in, I don't know, in Xinjiang province, you cannot assume that when you go to Harbin, the impact is going to be the same because the control group is also going to be different.
Yeah. Okay. Farzana was raising two very important issues. While ideally the gold standard that a lot of these what we call randomistas, those who advocate the randomized control trials in impact evaluation, is that you should have treatment and control group. A lot of the programs cannot have control groups because, for example, if the law says we should immunize all children, you cannot suddenly say this child cannot be immunized because they have to be in a control group. That would be both unethical and illegal, right? So in those cases, the randomized control trials cannot be implemented. But it doesn't mean that there are no other impact evaluation methods that can be used. You can still use, there are other impact evaluation methods that can be used. You know, that does not really involve controls that are denied treatment in the beginning. Because what you can do is that you let the program be implemented. Presumably after a year, there will be people who will not be vaccinated, although the intent is to vaccinate them. Oh, for some reason, some are not going to be immunized. So you use them as your controls. But they have to be matched with the same characteristics as those who have vaccinated. That's the, so in that case, you don't really have a legal or ethical issue because you did not control them from getting vaccines. It just happened. A lot of things happen why children don't get vaccinated, right? Their mothers are not going to the health centers. There was a typhoon in their area, and therefore they could not go there. So you use this as your potential controls. Okay? So I'm going to discuss different types of evaluation methods. Each would have its advantages and disadvantages, feasibility and non-feasibility, and what kind of results can you expect from these different methods. The other point Farzana raises about what we call the external validity. Okay, yes, it is true that it works in this area, but can you replicate it? Can you scale it up? Can you transfer the same intervention in other areas and expect the same results? So that is the question about external validity. How well can you import or use the lessons or interventions that have been demonstrated to be effective in one area in other areas and expect the same kind of results? Again, there are ways to do that to ensure the external validity. But you can only push external validity so much, as you will see later. Because well, let me proceed. Am I making sense? So it's a question about external validity, and then the other one is the are we limited to using just one type of evaluation? What if we cannot do that? What else can we do? Okay. So, this is a clarification I made that all of those who did not participate in our new farming technology program can be a counterfactual, right? Because they have the proper counterfactual has to have the same characteristics as those who participated. That's all the. Okay, let me see what I've just been. Okay. Oh, I won't go into Farzana's issue until tomorrow, but just to get ahead, right? Suppose you want an intervention that works for people in Tajikistan, for example. So you use a sample of Tajik people. Is that how you call them? Tajik people. For an intervention. So you see that it works. Then you can only scale it up perhaps to other places in Tajikistan, but not in Kyrgyz, but not in Armenia, not in Georgia, not in the Philippines. Because the other factors that you assume to be constant are not actually constant across countries. We have different governance systems. We have different cultures. We have different bureaucracies. So perhaps an intervention in Urumqi can work in other provinces in China, but not in other countries. So it is that we use may not necessarily give us a good estimate of the true impact of the intervention. Whether you use ex-post evaluation data, before, after, with, without, and even difference in difference data are not necessarily good impact estimates because of so many technical problems. Okay? Tomorrow, I think I'll discuss the specific methods for doing impact evaluation. Here, let me just proceed with qualitative evaluation. So in addition to quantitative methods, sometimes we use qualitative evaluation, right? What would be the sources of qualitative information? Stories, basically, narratives from historical records, administrative reports, letters, legal documents. Media, sometimes the media comes up with an expose or a news event telling about the good effects or bad effects of the program. So you can use this as your source of information for doing qualitative analysis. For many of us, we also do informative interviews. We go to the project areas, we interview the knowledgeable people, either the head of the government in that area, barangay captain, or the community leader, or politicians, or the head teachers, or the head doctors, who are knowledgeable about the program. So we do informative interviews. Sometimes we do focus group discussions. We gather a few mothers, talk to them how the program was implemented. We call that the focus group discussion. Or sometimes we live in the area and observe how things are happening. Right? You live for some time in the area, you make observations about how the project is actually implemented. So we call this sometimes participatory approaches, or archaeologists, anthropologists are very good at doing this, sociologists are very good at doing that. Right? Okay, so how do you analyze the different qualitative information that you get? Well, you can get a narrative, you make a story out of the qualitative information. You can do a visual presentation, or you can convert qualitative information into quantitative data. For example, yes, no can be translated into quantitative indicators, 1, 0, 1, 0, and then you just average the qualitative responses. Sometimes the answers would be most likely, less likely, least likely, not at all. So you can actually use numbers to represent the different rankings, for example, of responses. Okay, so there are different uses of qualitative evaluation. For example, here, suppose you are given a matrix of different colors. I don't have different colors here, but as you can see, the topmost cell should be yellow, the next one should be green, and the bottom, right, the opposite should be orange. Okay, so you have this scatter plot of a matrix of different colors. So how do you make sense out of this qualitative information? You can categorize or put the information in terms of primary colors or other colors, and then count. Then you make that conclusion. So from that matrix, I have 172 primary colors, 143 other colors, so forth and so on. So you summarize the information from that visual display of different colors into something quantitative. And then you analyze the pattern in the data. You can do that by quadrant. You divide the whole matrix into four quadrants, and you say where the colors are in those quadrants. Okay? And that's one information. Now, suppose you upgrade a village, a road passing through a village about 15 kilometers from the top. And then you make a focus group discussion of mothers and daughters or whoever are the beneficiaries of that road. Okay, so what do you get from focus group discussions? A lot of stories, right? Because you're asking them, they tell you a lot of information during focus group discussions. This is my favorite. Okay, bad women come to the village because of the road. The road was constructed, that corrects the village down, and these are the kind of information that you get based from focus group discussion. They say the bad women come to the village, or I open a post office account, or I got shoes for the children. So these are the kind of information that you can focus group discussion. And now you want to link this information to the road constructed, right? Because in the focus group discussion, although you wanted to tell you one particular story only, how they benefited from the road, you cannot prevent them from talking about so many other things. It's all up to you as an analyst to link all this information to the road project. Okay? So how do you do that? Well, you can classify them as a positive or negative. Okay, how would you classify bad women go to the village? Is that a positive or a negative feedback? You didn't judgmental. No. Well, yeah, you normally go as a negative impact, right? Bad women are going to the village. I'm just joking, I'm sorry. But the point I'm trying to make is that sometimes negative, positive differentiation can be very subjective. Yeah, so that's when you evaluate qualitative information, you have to ask these questions whether these are objective answers or subjective answers to the question. Okay? What is this thing called mixed methods?
It would just be a support of quantitative evaluation. Can a qualitative kind of evaluation can it be a standalone evaluation, or would it just be a support to quantitative evaluation?
Well, neither the quantitative evaluation or qualitative evaluation should be a standalone evaluation. That's what we're trying to advocate here, mixed methods. Mixed methods says you use both.
Like in media, if the media says that this kind of project works, but it came from a biased source, like a donor, would you believe in that kind of evaluation?
No, of course not. That's why the idea is that we use as much information and as much objective information as we can to make an evaluation. Whether that comes more from qualitative information or from quantitative information, you use that. But ideally, you should be using both quantitative and qualitative. Because the quantitative method is rather than, it doesn't tell you the story behind why it works and it doesn't work. It only tells you what happened. But why it happened and how it happened, it doesn't tell you that. It is qualitative information that will tell you that.
I also want to ask this because there are many evaluations that have already been done, like for transport. Could you institutionalize them? So for certain road, 28% increase in something. So you will not repeat again that kind of evaluation because you can come up with a conclusion, like coefficient of certain intervention.
Like for example, you establish a threshold above which the project is successful and then below which the success.
No, like you build 100 kilometers of road. There is a certain effect in terms of settlements, how many people would go there, how much income it create. So you can establish a relationship like coefficient, 28%. So when you establish 100 kilometers of road, 28% increase in income. Is it done like that?
No. The tricky part about evaluation is that the impact may change from one area or type of intervention to another. Precisely because of the other factors that contribute as well to the impact. Now, your question now is that, suppose it varies, right? Say, in certain areas it contributed 20% in income growth, in other areas 15%, so forth and so on. Then what is then the justification for favoring this intervention rather than another intervention? You go now into what we call the cost effectiveness analysis. To achieve a 20% increase in income through a road project, is this a better way to do that or something else? So they call that the cost effectiveness. Is this intervention the best way to achieve a 20% increase in income, for example? Is it a road network or something else or something else? You can think of different roads as well. It could be a concrete road, it could be asphalt, different kinds of roads. Okay, because different projects will have different costs, although they are targeting the same kind of output. So to answer which projects should be favored or not favored, we use what we call cost effectiveness or cost benefit analysis. Okay, am I making you sleepy? Yes? Okay, I'm sorry about that. We don't have a coffee break, so I'm going to be your coffee for the day. Okay, so mixed methods. This is what we're advocating. In addition to using the quantitative approaches, we also make use of the qualitative information. The idea is to get a complete picture of what happened with the project. We're not simply satisfied whether the project has contributed. Sometimes a more interesting finding is that why did that contribute? And what lessons can we learn from certain projects like that? What to avoid in the next project, so forth and so on. So usually the quantitative approaches will not tell you that story. The qualitative information will tell you that story. Okay? So mixed method simply says combine quantitative and qualitative approaches. Okay? So what would be the quantitative supported by qualitative information? Well, you use the qualitative information, for example, in drawing up the evaluation design. Okay? Including understanding who is in the program, who are the actual target beneficiaries. For example, in the Philippines, we have a conditional cash transfer program. Are you familiar with the conditional cash transfer program? You identify the poor, you give them money every month, conditional on them bringing their kids to the health center for regular checkups, and then make them attend school. So only if you do those things will you get the money every month. If you do not do those things, you don't get the money. So that is why it's called a cash transfer, but conditional on seeking care and sending your kids to school. So it's called a conditional cash transfer program. So by design, the target beneficiaries of the conditional cash transfer programs are the poor. But you know, there are many types of poor. The very poor, the near poor, and the very, very, very poor. Meaning that all poor are equally poor. Right? There are just those below the poverty line. There are just those who are above the poverty line. Just above the poverty line, but very vulnerable to typhoons, to climates, things like that. All of a sudden, they become poor overnight. And there are those who are very, very poor, that they cannot really afford 3 square meals a day, for example. So the way it was implemented is just, well, we're not interested in all poors, we're just interested in some poors, because we cannot afford to provide conditional cash transfers to all poor. So we have to determine which poor we're actually going to enroll into the program. So if you don't know the details of the program, the way it was implemented, you might think it is a failure because not all the poor were covered. But if you read the program, the design of the program, it wasn't really the intent of the program to cover all the poor, but only selected number of them. So a proper evaluation would be, you would have to limit it to the actual target beneficiaries, not to the total number of poor. So that's the kind of information that you can only draw out from the qualitative information. You have to understand the way the program was actually implemented. Okay? And then here, also, in the quantitative information, you will get these unintended outcomes. The other bad effects or good effects of the program, which were not part of the things that you monitor or you monitor in the beginning. Like for example, in the growth network, one unintended consequence is that the bad women are coming to the village. So presumably there were a lot of marital problems because of that. That's a kind of unintended consequence. But you won't get that from the quantitative indication. You can only get that from the stories. Okay? Triangulation basically means you validate your information from different sources to other sources. So you have information about the impact of the project from quantitative measures, and then you triangulate and validate them with the participants in the focus group discussions or in the informants or from administrative records. That's all what it means by triangulation. Validating your information from different sources. Okay. Are you interested more about this stories about the Philippines? No? Or more? Okay. So here's another one where you can use a kind of qualitative information, this method type approach, right? So we have this national health insurance program in the Philippines. So it's supposed to cover all Filipinos. Okay? So a special program is developed for the poor. Okay? You want them to be enrolled in the insurance program. And you want them as well to use healthcare more often because they are the most vulnerable to diseases in the population. Okay? So one intervention is that all those who are enrolled in the program may go to their health centers, community health centers, or outpatient care. Normally, an insurance will only cover hospitalization, but not outpatient care. When you go to a clinic only for a checkup, normally that's not covered by the health insurance. What it covers is when you get hospitalized. Okay? But you want to improve the health of the poor. So a lot of them might need outpatient care more than health hospitalization. So to encourage them to go to the outpatient clinic, we have this what we call a capitation program. What it does is that the National Health Insurance Company, the PhilHealth, gives money to the health center, and the health center promises to treat any and all poor who come to the health center for outpatient care within the year. So it gets a lump sum in the beginning. In exchange, it provides services to any and all of the poor who seek care in that area. So what that's called the capitation outpatient benefit package. So the impact should be improved health of the poor, at least in the area surrounding the health clinic, right? Because now they can go to the health clinic for free and get treatment. And the health workers are under contract to provide health care because they got the lump sum from the health insurance company, right? So there is incentive for the health workers to treat the poor. The poor have incentives to go to the health center to be treated because it's free. So it looks like a win-win kind of situation, right? So, but it turns out we haven't done the proper evaluation of this program. What we have are feedback, stories, narratives from different places. They say it's not working. One reason why it's not working is that because the money that is supposed to be given to the health clinic goes to the local politicians who use it for something else. So as it were, the local health workers cannot buy the drugs, all the medical supplies, to treat the poor. And since the poor are not seeing any improvement in the health care when they go to health clinics, they don't see the benefit of fewer of them will go to these health clinics. So while we don't have an impact evaluation yet of that project, we already begin to get some feedback from important interviews about the likely success or failure of that program.
Just one question. How did the local government spend the money on other purpose?
Oh, okay. You know, the local governments in my country are very, very strong. Well, one is that they have fiscal autonomy, basically. We have a law that says that local governments have fiscal autonomy. That's one. So that's why they can choose to spend that money for other government projects or services. The second one is that the money is not really, it's not kept under what we call a trust fund. It becomes part of the general fund. You know, the general fund is like it's not a dedicated fund for health. It's a fund for all government operations. So the money gets mixed up with all the money for government operations. So it's very hard to separate what is for health and what is for other purposes.
So where is the evaluation of these changes?
No, we haven't done the evaluation. That's my point. We don't know the real impact yet. But what I'm saying is that we already have some stories. It's not really a quantitative impact evaluation of the program, but some qualitative information that tells us that it's not working. It's just exactly the story I was telling. So it's a very, it looks good on paper, but it doesn't look like it's going to work. Okay? Okay? Okay, next. Oh, okay, here's another intended outcome of road project, increase in road accidents. It happens, right? Because the road project, a lot more vehicles are using that road, and the likelihood of accidents also increases. Okay, so these things will come out during the focus group discussions and key formal interviews. Okay, so question now, is the project good or bad? And that's very hard to evaluate, right? But it doesn't mean that you should not take into consideration all these things. But what is the proper intervention then? Don't build the road because it leads to more accidents? No, perhaps the proper intervention is build the road, but build all the road signs and teach the people how to cross the street properly, things like that, or enforce traffic rules. Right? So that's it. That's it. We haven't got into methods more. We're going to the nitty-gritty of the methods, but it's more like a big picture of what impact evaluation means nowadays in development work. Any questions? Yes, please.
好，有一个问题啊，首先非常感谢这个 Joseph 教授给我们介绍了这么多评价的方法。那我有一个问题，就是这些评价的方法可能各有利弊。那么我们对于一个项目的评价的结果，可能这些方法它得出的结论可能是不同的，或者是甚至是矛盾的。比方说定性方法还认可的，但定量，比方说您刚刚给我们介绍那个被插法，他又是觉得这个项目是不可行的。那么当这样的情况的时候呢，如何去评价这个项目是否可行？谢谢。
What do you mean feasible? Feasible ex ante or feasible? The evaluation, is it feasible to evaluate it or feasible to do the project?
对，就是也今天给我们介绍的就是这个评价这个项目的评价，项目是否可行，就是这个项目是不是要去执行，或者项目的这个项目完成以后对这个项目的一个评价，到底是好还是坏？
Okay, the evaluation we're talking about here so far is that the project is already paid, completed, it's implemented. What we're evaluating is its impact, whether it delivers the intended results. Then you're asking about whether we should proceed or not with a project. I would answer that on two levels. One is that should we implement the project, meaning implement it elsewhere or scale it up? Well, that will depend on the impact evaluation of a particular pilot project that you're evaluating. Now, if you're asking whether to implement it the first time, that's just ex ante evaluation. That's where you do the feasibility studies and all these things. So I think we're talking two different things here. Whether your question is whether to implement or not the program. The assumption here so far is that the program has already been implemented, and you're just asking the question whether the program as implemented delivers the intended results. And then the results, as measured, will now be the basis for your decision whether to scale it up, to implement it elsewhere, or to roll it out in other places. But that's not a different issue. Well, if your question now is whether to do it the very first time, even to do the pilot. You do the ex-ante evaluation when you show feasibility stuff. That's a different issue. Now, if the question is whether it's possible to do evaluation, it should be possible to do evaluation. The only question is that what is the appropriate evaluation methods to apply? You should always.
I think the question was, correct me if I'm wrong, also that if you, this is the question I think I was also talking at lunchtime, is that is everything you do amenable to quantitative evaluation? If sometimes we cannot get the numbers, how do you evaluate? Or do we say that you can only evaluate something which you can measure?
If you cannot measure, what was then the basis of the program? What was your intended result in the program at the beginning, if you cannot measure it?
I don't know who was asking that question. I don't know the answer to that.
I mean, before you do the evaluation, presumably you decided to implement it using some numbers, some indicators.
就是我想知道的就是这些评价的方法，我们获得了刚才这个包括上午的课程，我们获得了很多的评价方法，像您刚说的这个事前事后对比啊，还有这个被插法呀，还有刚才介绍的一些方法。就当我们对这个事后这个项目的评价，那这些方法得出的结论是不同的时候，我们该如何去评价？我们该如何判断？
You use different methods to get different results.
No, if you have different, if you use different evaluation methods for the same project.
比方说定性的方法，我们获得的是一次。
Oh, okay. But then you rely on the strengths and weaknesses of the different methods. You can usually rank the different methods in terms of strengths and weaknesses. I think the development literature and development work now, they're always aiming for the randomized controlled trials because it eliminates biases. All the other ones are susceptible to biases. I think we're going to discuss that tomorrow. The gold standard that almost everybody is pushing is what we call the randomized controlled trials. Of course, you cannot do randomized controlled trials every time, simply because it's illegal sometimes, it's unethical sometimes. For example, I don't know, you grant the right to vote to everybody. You can't have a control group. You cannot have a control group. You say suddenly you cannot vote because you're part of the control group. That would be illegal. So in that case, you cannot really adapt randomized control trial. You use something else, right? Or for example, you have a peace-building intervention. After conflict, you try to integrate the rebels into the political system or economic system of the country. You cannot have a control group. You just say to the rebels, no, you cannot participate because you're in the control group. That would be impossible, right? I mean, so in that case, randomized control trial cannot be implemented. But it doesn't mean you cannot evaluate it using other methods. You just have to take note that the other methods would have their own weaknesses. That's all I'm saying.
我有一个问题，就是刚才问题的延续，就是当那个数据不可得的时候，可能我们会采用定性的分析方法。那么就是在我们国家现在在一些研究当中存在这样的现象，我们总认为定性的研究方法得出这些结论不一定是非常的可靠。那您怎么看这个问题？再接下来一个问题就是如何使一个定性的研究能够更加真实的或者准确的反映这个项目的结果如何？谢谢。
That's always difficult. Our question is, suppose we don't have quantitative data for some reason. Either they were not part of the original scientific evaluation, or the data simply do not exist. Okay, then you rely on qualitative information. And she said also that, qualitative information will give you different kinds of results, right? Some positive, some negative, and they're not therefore not reliable because they may be using subjective data or unreliable data. How do you improve the reliability of qualitative information? I think there are you cannot completely eliminate the subjective bias or from anything more from qualitative information. But one way to do that is use a structured interview, for example, so that you ask the same question from the same respondents, and then the answer that you anticipate can be begin to be compared across respondent groups. Because if you have a free-flowing exchange, then the information can be very hard to compare across respondents. Sometimes you can also translate, as I've said earlier, the qualitative information into quantitative data. For example, ranking, yes/no responses, other kinds of information. You can hold them and then make a statistical analysis of this qualitative information. Right? A lot of information are quantitative, even from the usual surveys. For example, are you a registered voter? Yes, no. Did you vote? Yes. Who did you vote for? Candidate A, B, C. So these are qualitative information, but you can translate them easily into quantitative information, right? But short of that, using structured interviews or questionnaire, and then transforming the qualitative information to quantitative information, subjecting them to the usual statistical analysis, appropriate logic. I don't know what else, how else to validate, or to reduce the subjective bias from this qualitative information. But ideally, you should indicate already right in the beginning of the program what kind of indicators should be used, so that they become part of the program implementation. Right? That you don't have to collect them ex post. Collecting them ex post could be very difficult, because if you want baseline data and you collect them ex post, you ask them, what was your situation in life 3 years before? Then you get all sorts of recall bias, right? I mean, I can even remember what happened to me yesterday. You are asking me what happened to me 3 years before. And then you want a very detailed expenditure data about my expenses 3 years before. That's going to be very unreliable information, right? So I think the lesson is that we have to take monitoring and evaluation seriously as part of our work. Towards doing that, we develop the indicators, the system right there in the beginning, so that we don't have to be looking for other whatever indicators after the program. Are all results measurable? That's a difficult question. But it begs a question: what justified the program in the beginning? What indicators were you looking for? Often the things that I think that cannot be measured, like for example, you want to adopt a new constitution. Right? So what will be your outcome impact indicator in the shift in the constitution? A lot of things, right? I mean, ability to vote, women can participate, children get treated well, the poverty reduced, so forth and so on. I mean, it's a regime-changing kind of, and then the indicators are very hard to identify in that case. But for projects, programs, intervention, I think you can specify the expected results much more concretely in the beginning. Political changes are very hard to subject to quantitative impact analysis. What is the impact of let's just say, what is the impact of the French Revolution? And there's a quotation that says, I think from one of the leaders of China, is it Mao Zedong or Deng Xiaoping? And he said that probably it's too soon to tell that. It's too soon. The French Revolution, when did it happen? Hundreds of years ago, right? So what's the impact of the French Revolution? It's too soon to tell. Meaning you have to allow for more time to see the real impact. But for example, once you introduce Yahoo in China, what will be the impact? Well, immediately you can determine that, right? The number of clicks, the number of hits, you can determine that. So it depends on the kind of indicators that you can use an instant, just-on-time indicator, or you could use a very long-term indicator experience about doing randomized controlled trials in your country, or difference analysis in your country? Maybe you would like to share them with us. And what's the usual evaluation that you do in your country? Before and after kind of evaluation? I mean, when your supervisor, for example, asks you, okay, evaluate this program, what is usually reported? It's a kind of before and after kind of analysis, with or without, or just one number that it says it's 1,000 kilograms per hectare, let's say. Or they don't ask you to evaluate anything. No evaluation, just monitoring. You probably are. Okay, let me close my session now. Thank you very much. The senior forum.
Okay, so we have a choice now. We were supposed to have a country presentation, but I guess we had planned this evening for people to leave early because of shopping or etc. So do you want the presentation tomorrow morning or now? Who's for tomorrow morning? Who's making the presentation? Are you okay for tomorrow morning? Okay. So we'll have tomorrow morning, but before I close, I cannot close before I make a certain comment. So, and I think those of you know what a comment I'm going to make, because some people came back late. So if I can just discuss this in terms of the results language. Okay, so the activity of coming back late had certain outputs. Okay? The first output was we did not have the benefit of your contribution. The second, of course, was that the other participants did come on time. And it would have been nice to have had you there. The third was that we had presenters who were here taking the effort to make a presentation. So there was some clear obvious output. And the outcome was obviously also clear, is that you missed probably the most important session on impact evaluation, which is explaining rigorous impact evaluation, which you will need for tomorrow. But there could also be some impacts, because you represent your country. Okay, and valuable resources are spent in bringing presenters. We have our Chinese counterparts, of course, who have given us the resources here, and there could be also an impact in terms of, future attendance, either from your country or from yourselves. So I think there are consequences of certain actions, and I think here the results change is quite clear. So, but you can mitigate that. You can mitigate that, because tomorrow you're going to be doing breakout groups. So as a result, this evening, you can perhaps read the notes that on the different types of evaluation, perhaps try and get a good understanding of what was said. And I'm sure Joseph tomorrow morning can answer some questions so that you can participate. And those people who were unable to come on time, I won't say came late, unable to come on time, maybe can be the lead presenters from the workshops for the breakout groups tomorrow. So you can clearly see that you have studied and have been able to contribute. So let's show some positive results coming out of all of this. So thank you very much, and let's have a pleasant evening. Thank you.